Hi everyone, this is Josie from OPWDD. We're still waiting on a conference room to join, so we're going to be just a few minutes, but I wanted to pop on and let everyone know we are here. The meeting is happening, we're just running a little late. Thank you. Can our New York City office hear us?
Yeah, we could hear you, Josie.
Hi,
Hey, we
Josie.
can hear you. Welcome.
Hi, welcome.
Your camera is not currently on, but if you guys are agreeable, we can get started since we're just running a couple minutes behind. How about here in Albany? Is everyone ready to begin? Okay, I'm going to turn it over.
Good morning and welcome, everyone. My name's Kathy Nowak, and I'm the interim co-chair with Gail Pato, who is not able to attend today because she is enjoying her second honeymoon. The commission is statewide FSSAC. You have a long time for your second, your 25th, is meeting this morning in person at the primary meeting space, Empire State Plaza in Albany, and in two other meeting locations, Center for Family Support in Manhattan and People, Inc. in Williamsville, a suburb of Buffalo. I'd like to thank our host locations for giving us the use of their space and helping us meet the requirements under the open meeting law. All three locations are open to the public to attend. The public has an option to attend virtually as well. I'd like to thank all the committee members and Commissioner Nightfield and her senior staff for attending today. Alexis Harrington, Chad Colarusso, Nick Hobson, Jessica Pigeon, Amy Burdick, and of course, Josie Yankowski. We have many others that are remote as well, and thank you for coming too. Based on the RSVPs, we have a quorum, and I'll now take attendance to confirm that. So as I call your name, please just say you're present. I'll start off in Albany. Ann Sheriff.
Present.
Scott Brady.
Present.
Kathy Nowak. Yep. Jan Fitzgerald.
Present.
Tina Vale.
Present.
Mary McGuire. And Maria Suki Kozak.
Present.
Buffalo, do we have Karen Eichenseer?
Present.
Crystal Vasslier?
Present.
New York City, Deborah Greif?
Present.
Mary Fasano?
Present.
And virtual, Jennifer Goldman?
Present.
Chris Palega?
Present.
Aliyah Hussein?
Present.
Okay, and that fulfills our requirement to have a quorum. And I'd also like to note that Mary Fasano, who's in the Manhattan location, is going to be watching the clock. so that we stay within the agenda time limits, and you know she certainly will let us know if we're going over. Also like to ask our committee members if you have questions or want to speak or you have comments, to please raise your hand, and we have Tina Veal and we have Mary McGuire who'll be looking out for you, and they'll be jotting your name down, and we'll call you in so that we don't talk over one another as well. So we're going to have Alexis Harrington start us off with a short update, followed by our subcommittee reports.
Can you hear me? Oh, perfect. All right. Oh boy, I hate using a microphone. I'm sorry. All right, so I just want to do a really quick update before we go into the updates from the subcommittees. Just recognizing that we have formalized bylaws in place finally. Yes, we love that organization. We love that structure to better define what the local councils consist of, the roles and responsibilities, and also a better understanding of the statewide committee role and responsibility. With that in place, I just wanted everybody to know that we are committed to better understanding what the information is that's needed at the local and statewide level to be supportive in that work that's being done by these committees, including that assessment of the current FSS programs. We understand that the local councils should have always really been involved in discussions around contract terminations and amendments, and we would like to consistently be able to share this information in a uniform way moving forward. Ad hoc report requests across the state have been very difficult to manage in a way that puts the entire state and all local councils in a position to have helpful information across the board. So I just want to put that invitation out there that we welcome a better understanding of the information that will be beneficial to support the role of the local councils, including information about contracts. And Nick will be providing an update on the status of compiling that information statewide. And that's the contract specific request. But please be thinking about what it is that will be helpful so we can compile that list across the state, have a consistent approach, and also explain to you what that frequency will be and make sure that that makes sense for all of us. So I just wanted to put that out there before we dive into the updates.
Thank you. And I believe maybe Scott will have some things to add to that. So when we get to his report,
Perfect.
he'll talk about a discussion that we had regarding that.
Alexa, can I just, I don't know everybody. And so we announced all the folks
I'm sorry.
from our side. If we could
Well,
just do some introductions for, I'm a rookie here.
Yeah, you want us to do introductions for OPWDD in the room?
well, that's what I meant when I introduced
Oh,
you.
oops,
earlier.
sorry.
You didn't know who was who.
I just ran ahead. So for those of you who don't know me, I'm Alexis Harrington. I'm the Associate Commissioner for Program Implementation and Service Access. And I will throw the ball over to Chad.
Okay, hi, I'm Chad Colarusso, OPWDD Director of Family Supports, which encompasses family support services and self-direction. So I'm going to toss it to Nick.
Morning, I'm Nick Hobson. I'm the FSS statewide coordinator.
Amy Burdick, Assistant Statewide Coordinator for FSS.
Good morning, Deputy Director of the Office of Strategic Initiatives, Jessica Pigeon here from OPWDD, and I'll pass it to the Commissioner.
I'm Carrie Neifeld. I'm the Commissioner of OPWDD. Got Josie over there too. Who doesn't have a microphone, but Josie Yankowski, who keeps everything running.
Thank you, and I apologize.
No, thank you.
No, that's my bad. Sorry. I was so eager to get started.
Everybody new in the room.
I know, right? And we do have some people on the line from OPWDD. I see Abiba.
Hi, good morning, everybody. My name is Abiba Kindo. I'm the Deputy Commissioner for Service Access, Program Implementation, and Stakeholder Supports at OPWDD.
And Christine.
Good morning. I'm Christine Carey, the Associate Commissioner for the Division of Fiscal Policy and Management.
And Deb?
Hi there, I'm Deb Ellis. I'm the Senior Advisor for Operations for OPWDD.
And Josh?
Good morning. I'm Josh Olson. I'm the Deputy General Counsel at OPWDD.
And Kevin?
Good morning. I'm Kevin Valentius. I'm the Deputy Commissioner for Fiscal Policy and Management at OPWDD.
And last but not least, Mary Beth?
Good morning. It's Mary Beth Babcock from Council's Office, Bureau of Policy and Regulatory Affairs.
Thank you. So next up, our RFP subcommittee is chaired by Ann Scherf, and she has Maria Succi Kozak, Tina Vale, and myself working with her. Ann, can you please start with a summary of the progress that's made within this subcommittee? And I ask the other committee members to join as well.
Okay, we've met a few times, and what one of the questions that without the DDP4, how can we determine priorities for because we don't have that to draw from. So what we had done, we collected the information from all the regions as far as what programs they're offering for family support services, and looked to kind of analyze those to see what kind of programs are prevalent across the state. So I guess one of the questions we have is how do we establish priorities by looking at those, what's already exists, and talking to local councils to see what they see as needs. And that was one of the discussion we had Western and North region last week when we talked. We asked about what they felt were needed areas for family support services.
So can I just add
Sure.
to that? We understand that the DDP4s are no longer being used, and that was one way some of the councils determined their priority need areas. Some others would sit, like Ann said, and because their community is small and they know each other in some areas, and they would figure out what was needed. So in addition to collecting those programs, we were looking to see what's prevalent, but also see what other committees had throughout the state that might be something. I've already seen a couple that we don't have that might be a good fit for in Staten Island.
Right.
So that's one, the two uses of that list of programs. What we would like to see going down the line is maybe rather than having 12 documents and pulling it together, maybe we could think about in the future having a central database of all the programs, and even broken down by area, by how much money. I know I'm asking for a lot, but it doesn't seem that we have that information in one place. So we would like to just have a short discussion on what other people here think that would be a good way, how to identify needs. We all know that we have an allocation coming down, and we really can't even start anything until we identify priority needs.
So Kathy, if you don't mind, I just want to recap something that I think we covered in a meeting previously, and let me know if this is ringing a bell for others. But I think I remember Gail noting that there was a tool that she had used in Region 2 that helped understand what unmet needs were in the region or in the district. Did that?
You're absolutely right. She did mention it. She looked into it because she didn't have it herself, and she reached out to Region 2. They said, no, we don't have it. We kind of asked around everybody else, do you have a tool? And no one seems to have a tool of any kind.
Okay.
So that's where we ended up coming back, trying to figure out, do we design a tool? Do we just have
Okay.
our little meetings and determine priorities that way? That's the question. And on top of that, which would come at the end of this report, is that we had many questions. Not even that, from our last meeting, that we have found that we really feel we need help from OPWDD, a person to just help guide us. We just are, it's a big challenge to be given this money and said, well, you could decide how you want to divvy it up. And, in the past, when we got our allocations, we got it by our little councils, and the little councils met and each one had their own priorities. At some point, it moved on to regional priorities, which was difficult enough. I'll talk about the 5 boroughs were very different. I'm sure the other parts of the state, Anne has one that's really specific to the Indians. What culture?
Native Americans,
Native
yes.
Americans. I'm like, wow, that's really something. So that's actually has to be, so that's just one. And the other is the process itself. I understand that up by Gail in Region 2, she didn't personally experience it, but there was a RFP, because there have been local RFPs over the years, not statewide. And Gail said that they used a computer system that you were changing. Am I making that up? A gateway or?
Yeah, so eventually we're going to move out of the current platform that RFPs, RFAs, and contracts are executed through. That shift hasn't happened yet. So it will be a move away from Grants Gateway into FSS. So that training will happen for everybody when that shift happens, but I have not received an update that it's happened yet.
So that's what we are interested in knowing. Will that shift happen for this RFP, whether you use the first system or the new system? Because my personal experience has been where everyone who has a conflict of interest sits at the table and reviews it together, because you have new people that come in. They have no idea even what they should be looking for. So the more experienced family member will train the younger family member. Tina, do you want to share what you recently had? Not recent, like last year, but you said that you were one person that was appointed as on a committee?
Well, it was already done for us, and it was just that they asked me as a parent to join in on that. And they had picked the people that were going to be on. It wasn't like we got to decide who else was going to be on there.
So, and that was news to me. So that's something else we have to be consistent with. So that was just 2 examples. Do we have any more questions that we had? And I'm saying that you might not have an answer for us yet.
So it sounds like there's questions about overall process.
Yes. Timeline.
Right. And I mean, so just to be totally aware, like this pot of money was identified a while ago. So timing is critical. We have an opportunity for you to tell us what the unmet needs are. We don't want to dictate what that process is, because what we have heard is that you want to regain that control. And that's really what's articulated in the bylaws. So it sounds like there was a tool that existed that nobody can find. We can do some digging on our end to see if we might be able to find that tool. But if it was something that was owned by the local council and used there, it may be difficult for us to even find that if we didn't have our hands on that tool. When it comes to the RFP template itself, there was a more recent, before I came here, but there was an RFP that was issued in, I believe, Region 1. So we have that template. It has been refreshed internally. So that will be ready to go when the conflicts of interest are on file and the unmet needs are identified and you're ready to issue the RFP. So we have some of those fundamental, foundational building blocks ready. Oh, I'm sorry. Was somebody trying to speak?
I think one of the the satellite regions were unmuted.
Oh, okay. Abiba, go ahead.
No, I just wanted to respond to Kathy's initial point. Just sort of looking back in my records, Kathy, in terms of the unmet need discussion, I know previously local councils were able to, through their review and on-site reviews of contracts, right, understand where providers might have a wait list for folks waiting for services, right? And maybe that might be a decision point to allocate funds so that additional folks could be served. I also know that some of the councils in the past have used sort of a survey of their members at meetings, right? Just to understand, what the community needs to be able to meet and be responsive to families in that particular catchment area. So those are just some ideas in terms of how folks have determined, where they may need to allocate funds to help address the needs of individuals and families.
If I may make a comment here, that's true that we used those in the past. With COVID, things changed. And since COVID, they've been reviewing, at least in our region, just, programs that were having issues. So we might not hear about the wait list that other programs might have, as far as that going forward. But even in talking with local council meetings, parents are aware of some services that are need out there. And just, I reviewed Region 1 and 2 as far as the programs they had to offer. And it was interesting to see the differences. And there's some that probably programs that aren't quite needed going forward that could be better utilized in other ways. Just being out there. Families, I think one of the things we talked about is family events and recreational kinds of activities where they're skill-based, providing that. Versus when family supports first came out, the technology wasn't available then to access information. And now information is easily accessible by most people. So that's an area that maybe, and looking at programs that aren't really up to date, if you want to look at it from that perspective. But just recently, in a personal experience I had with a friend that's going through a crisis situation, personally, I feel if families are in crisis, that's where family support should be all about, supporting the families, even if it's a phone call or a follow-up or a message, just to know that someone cares, that they're not lost in the system.
May I also, well, on this point, while we're talking about this, does anybody in this room have any questions?
I didn't have my hand up. I'm trying to figure out how to turn this on. Is it on?
Yeah.
Oh, okay. I did it. Yeah, so, and I was going to talk about some of this in the advocacy part of, and I'll talk about our advocacy group later. But in order to do an RFP and determine need, Alexis, you referred to us getting data. I don't even have, in my group, Capital District, we don't even have a current list of providers. The last time we got a list of providers was in November 18th of last year. We don't have budget information. So when you determine need and current utilization, you want to be able to say, well, what are the constituents using? What's meaningful out there? But we can't do that without a partnership with you. So it's okay to say, you want to turn this back over to us. We can't do it without good information and good data. So we need that data. We need the partnership. We need budget data, utilization data in categories. The other thing I'll just say is that within Region 3, there are one council I think is barely functioning and another one doesn't function. So there are services happening in those areas. So when we talk about, okay, let's do it for the region, how do you do that when you don't have a family support council functioning? That's number one. Number two, when we ask the state people, who are great people, but when we ask, they don't give us information because they say we want to do this consistently across the state. Well, there's a vacuum of information and you can't make good decisions without good data and information. So I'll talk a little bit about in advocacy. I think a lot of these things cross over. When we start talking about services, whether it's an RFP, stakeholder engagement, all of these things combine. The conversations probably sound a lot alike in the different committees. So anyway, my 2 cents on that.
I just want to add briefly, I concur with everything, Scott, that you have said. I've been on the local council for 20 years. And what I can say is we are not getting the kind of information that we used to in order to be effective in helping our constituents get the services that they need. We now, the information flows, I don't know how it flows, but we have care coordination agencies involved. Parents go directly to them. I don't know what kind of communication the local office is getting in terms of need. We used to have a very close tie with the FSS coordinators who in the past called us all the time. This family needs, this family needs. We don't get that kind of communication anymore. We used to be involved in the surveys, the satisfaction surveys. We used to review all of them. And we're actively involved in processing what the constituents were saying in terms of the services that they were getting or not getting. We don't see those anymore. We used to meet with the providers regularly during hours that were convenient for families. That no longer happens once the budgetary committee got involved in reviewing the contracts. Now it's during the day, during work days, and we struggle trying to find people who can sit on those committees during a work day. I mean, we're all working. So it's helpful to open that communication. I understand that. I'm very appreciative of the fact that Nick is going to we're going to compile a list and get to Nick in terms of the kind of information that we need to be functioning councils. But this money, when you say it's been out there a long time, during a time when we don't have what we need to function. So we need to try to figure out how to speed this process up in order to meet the RFP timelines.
Thank you. So like I mentioned before, the list of what is needed is what we need to be able to be responsive. So I'm hearing that you need that list of provider program types of FSS across the state. You also want to understand how much money is within each of those contracts. Now, just to recap what I said earlier, this is something that has existed at the local level. It has. We are now moving towards a healthy, functioning council. We just had bylaws that were passed between the last meeting and now. So we are already in a much better place. But we were talking about financing for RFPs before we had any agreement on what a conflict of interest is, why we need that in place, and what needs to be in foundational bylaws in order for everyone to function. So I just want everyone to understand those steps that were critical to take place. We're going to try to get that information to you on a consistent basis to help you, but we just need to know exactly what that is. So I heard you, Scott, that is what Nick is compiling right now. If there's something else that would be beneficial, let us know. But the unmet need thing really needs to come from the local level. We are not going to tell you how to gather unmet need. That has to be up to the local councils to communicate what is not being met. I don't think that you guys want us to tell you how to collect that.
In the past, we used to have our council meeting and we would discuss it with the FSS people, and then we would take it back to our DD council. Do you think that's something that we should try to do again? We used to take the information from the Family Support Council and take it to the DD council and get their suggestions also. That's where there was more providers at. At our Family Support was families, and then we went to the DD council where there was more providers.
And the 5 boroughs are the only
Yes.
area that have the local DD councils, which is comprised of providers and families and self-advocates. But that's one way. So I think what I'm hearing from Alexis is that we have to go back and start working on different ways. It doesn't have to be one way. It could be guidelines on how to collect and figure out local needs. And I think that's something that will be what we'll work on going forward. One of the things, oh, and I just wanted to ask out in Buffalo, do you have anybody who wants to speak?
No, not this time. Thank you.
And how about Manhattan?
Yeah, we have, Deborah would like to say something, and then I would like to say something.
Thank you, Mary. Well, for years, we would have the meetings with Tina said, but we would also, when we were doing site visits, we would read the consumer satisfaction surveys that also let us know what were the needs, because many times parents would tell us what if the program is working or not. And that is a very good tool. Since we mostly work with computers, we should set this up where the agencies who have the family support programs email to the family support councils what their consumer satisfaction surveys, so we see what family support programs are still working and what aren't. We also realize COVID messed up a lot of things, but it would be a great way because the agencies want to work with us and we want to work with them. So we want to be a team player so we can get the information we need. Mary, I'm done.
I would just like to say that on Long Island, we have been functioning with most of with the data that we do need. And as a council, we have maintained a comprehensive list of all the programs offered by the various agencies. Not attached to that is the dollar amount. I'm not sure that we have that dollar amount. But going forward, we're talking about the awarding of the RFPs. I'm concerned with some of the comments that were made about how once the need is established and the RFP is out there and the proposals are received, how they are reviewed. I would hope that it is a joint and equal discussion by the council or those appointed members of the council and the local DDRO people. It sounds as if that's not been happening in some of these areas.
My experience is different. But these are all things that we can talk outside of this meeting and, maybe come up with best practices. I don't have
When
any.
you say your experience is different in what way, Kathy?
We would have our family support coordinator sit with us and answer questions if we had it, but they weren't a voting member.
Well, yeah, so.
But Mary, I'm sorry, Mary, Kathy, I don't have a coordinator now that's doing that. I have to use other boroughs coordinators to assist me.
All right, let's not
You
go.
all do.
Let's not go into that.
I'm not going
aspect.
anymore.
All right, but just I think there should be some guidelines from Albany on the actual awarding process. I think that's where we could use some more clarification.
Well, in the past, we did have a scoring sheet that we
Right,
had.
but who did the scoring? That's my point. Who does the scoring? And in the past on Long Island, I know that we've had usually 3 members of the council and 3 people from the FSS staff or from the DDRO staff. And through the scoring process, we came to consensus. I don't know how it worked in other areas. That's my question. Can it be different in every area? Can it not be different in every area? I think this is where we need clarification.
And that's something I believe should go back into the RFP subcommittee, and maybe we could have more statewide members join us. This is bigger than 4 people on a committee.
Okay.
Okay. We agree.
And I actually do have also a comprehensive list of our family support contracts in Manhattan. I get that while we work closely with our DDRO. I think if Albany, as a general rule of thumb, makes all the DDROs work closely with their statewide reps to show them data on their contracts, what they have. We can compare all the contracts within the state, but it takes the work of the DDROs, family support coordinators in the local DDROs to work with the statewide reps. So we can collect the data easiest that way. I work closely with mine. I know what's going on. And I think what's great is we can see, oh, well, New York has these contracts and it's really well received from the community and the kids are using it, the adults are using it. YI especially has great contracts. So I think what we need to do is work closer with our DDRO reps and the statewide reps in order to gain this data and information on the comprehensive list of what's out there and where through the state we can expand that.
Thank you. And that's actually what we're trying to do is once we understand what it is that's needed, that's the coordination and the messaging that we share with the regional field offices of this is our plan and our communication moving forward. It's just been a little bit clunky. Like I said, with the ad hoc requests, like we want to support what is out there, but it's got to be consistent and it has to be in a way that you can use it and access it. And just the point about question about how RFPs are reviewed, I think it would be really beneficial to just focus on the order that things need to happen first. Let's focus on how you're going to determine what unmet needs are before we jump to who's scoring the RFPs. Like to the point made earlier about let's try to do this quickly. Let's focus on the order that things need to be done to get something out the door.
I'd like to point out that Chris has his hand up and has for quite a while.
Chris?
Hi, thanks. Yeah, I just wanted to echo a couple of things I've heard. One from Mary is this notion of being able to work closely with your team at the DDRO. When I first joined here, that type of relationship I think was critically important, not only to my learning, but also to the processes that we were able to put in place to efficiently run through an RFP. The relationships are so important. And a couple of things that Kathy mentioned, I think it's really important when we're doing a needs analysis that we do rely on multiple sources and we try to as she said, maybe list out detail what these sources might be that we can bring to bear. And I think also opening up to the larger committee and gathering more input from the members is also really important. And of course, I'll add, a survey, I think, is always an instrument that we should consider as well. Thanks.
Thank you. Anybody else have any comments? Oops.
I do.
Jan?
Just push this. It's not. I'm new to this committee on the state level. I'm a little familiar with navigating services through the decades, but my question is, because this is something I've never been involved in, is what's the role of care coordinating organizations? Don't they identify the needs of a person, what services are needed? Wouldn't they also know the gaps? And why wouldn't they be a resource for helping identify unmet needs?
Yeah, I think that's a great point. We do have, I don't know, Jessica, if you wanted to know anything, or I think Allison might be on or was, is she on still? Let me see.
Yeah, I don't think Allison's on, but it's something, is she?
I think I just want to also point out that not everyone that accesses FSS has care coordination. It's not a requirement to access family support services. So I just want to just note that.
You're right. I understand that everyone doesn't have care coordination, but it just seems like that could be a resource, and it's certainly not a resource that we could tap into
as volunteer members of a committee to go ring each care coordinating organization and say, what do you define your unmet needs as? It could be someone at a higher level might be able to help with this.
We'll definitely take that back. Thank you.
Alexis, this is Allison. Can you hear me?
Yes.
Yeah, I just want to point out it's a good, call out, and Alexis and I are happy to connect offline to follow up and just think about, this conversation and how to move it forward.
I guess I would like to clarify where we're going and where we're at, if that would help. The COIs have been signed, I believe, by a majority, at least in the regions they've been signed. That's been finalized, correct?
I want to speak a little bit about that. So we have a list of every person throughout the state who has signed a COI and has agreed to be an official member of the Family Support Committee, meaning that any kind of decision-making during a meeting can only be made, you can only participate if you have signed a COI. By the way, we have to sign it once a year because things do change. We do have, and one thing I'd like to point out to OPW is that our committee is very fluid. Like, we're going to have our first meeting in October. We may have 3 new members. People who submitted COIs last year may have dropped out. I believe it's going to have to be the responsibility with the statewide and the local chairs or co-chairs always in contact, but we're going to need OPW to make sure that we have updated lists of what the COIs are as of a certain period. It can't be once a year because decisions are made throughout the year. And quite frankly, we have people who don't want to review the RFPs. They don't care to vote on anything, but they like to come because they want to listen to what's happening and what's going on. So we can't kick them out. They have to be, we have to welcome them because they're there for a reason. So with that, we do have a list, and I would say that we're doing pretty good. Some regions, like I know, for instance, in mine, we have 13 members, 9 are signed. So to me, that's great. We have 9 people, hopefully 5 of them at least will participate. We do have some councils who are struggling, and we should have, according to the bylaws, I believe, at least 3 members on the committee. So we have to work on that. But we also have one council who's completely 100% non-compliant. So when we find that we have committees that are non-compliant, I'm going to propose that when the time comes, and I hope this will, maybe push the council to get together and come to understand why they haven't signed the COI, what's their issues, talk to us. But if they don't sign the COI, then wherever this is a proposal, by the way, and we don't have to have a vote, but it would be helpful. If that person is from such and such region, that local council, that money goes back into the region that person is part of. And that's that. And, I think if we're close, Alexa, help me on this. If we're close, just say if February was going to be the date we started this process. If we know it's going to be like 30 days in advance, if we don't have the COIs, that's it. Like at some point, we do have to have a cutoff. Does that, what? Yes, the deadline. So that's something that has to be looked into. I don't want to tell that, I don't think it would be right to tell that, council now, today, you haven't signed any COIs, you can't be part of this process. I think we should give them a chance so that they completely understand it's not just a matter of voting on RFPs. We do have bylaws coming up now. The local councils are going to be responsible in creating their own bylaws. You're going to be voting on it. So you need people that have the COIs participate um, uh, in that voting, only if they have their signed COIs. Does anybody want to discuss that any further? Do you want us to just think about that going forward, or does anybody have an opinion here in this room?
Kathy, it's Mary. I hate to say it, but I don't understand what you said. You, you have to have a COI to be a voting
I
member.
hate to say it, Mary. You want to say those things.
What is the penalty that you're trying to
The penalty is if there's a council that's 100% non-compliant, meaning nobody has signed a COI.
Right, okay.
It's not a functioning council then, that money from whatever region that council belongs to will then go back into the region, and the other local councils within that region will.
All right, so yours, okay, so wherever this non-mentioned council has other councils within its region.
Mary, you're the only one that has your own little council.
We are unique, you know
that. Unique, and obviously it's not you.
You are.
That's why I didn't understand what you were talking about. I apologize for being blunt.
Can I just speak to the council that might not be active? How do you get a non-active council to be active if you don't even know that area? I mean, it's got to come with the help of the local DDRO in order to get the council up and running.
There are members on the council who have not submitted. They exist, people exist and say they belong to the council. They have not signed the COI.
Then maybe it's not the council I'm thinking of. Are you talking
No,
about Takana?
I'm not going to, no, it's not that, but I don't want to talk about.
Okay, but my point is, I know of one in my region that is not active.
No, we're not talking about you because.
No, I know. I'm
Yeah.
just saying that there are local councils that are not active. And I, for one, in that region where there is a local council that's not active, wouldn't even know how to reactivate them without the local DDRO helping in the process.
We are really crossing over committee work.
We are. That sounded like a stakeholder engagement thing, which fits there nicely, I think.
No, sorry. We'll have a discussion. That sounds good.
So Kathy, just to flag something before others weigh in on what you noted, I think recognizing that there are some districts and some local councils that are 100% compliant, they should be able to move forward, right? I think that's what you were trying to say. And then, you know, if the statewide committee comes up with a deadline of when you'd like to move forward, you're saying that those who don't meet the deadline are not participating in that round of the RFP.
Correct. And the state is not going to hold on to the money to give it to them when they're ready.
Right. Yeah. I mean, because unfortunately the budget cycle does not work that way. So, you know, even having the 3.5 million available now is, you know, the question that we need to answer. So to the point of moving this quickly, I think that is the right thing to do. But I am not a part of the statewide council, so it's up to you to tell us what your next steps are going to be so that we can make sure that structure is in place.
So does anyone propose that we vote on this now, or would you like to have a further discussion?
I'd like to know when that 3.5 million will go away.
So we have to have that out by a certain date, right? Is it the end of the state budget year?
I don't think we have a direct deadline yet, right? We can go back and have those discussions, but it is getting pretty close given that the allocation commitment, I think, was made over a year now. But it's getting pretty close. I think that to the extent that COIs are signed and on file and folks can determine unmet need, we would want to see RFPs developed and out the door by the end of this quarter if we can, fourth quarter, starting in October, if we can accomplish that.
Since there is only about 5 minutes left allotted to this discussion, I would like to see that this question be tabled so that the wider council can discuss it as to how we would like to proceed. I think that we need to hear from more people on this issue. So I would say table it till the end of this meeting, or call a special meeting of the council. That's my proposal.
If I could make one more comment, though, I think there has to be a consideration for areas that have no participation. So I think there are services, family support services, and some of those, I think there are 2 councils non-functioning in the state and one that functions very, I think it's 1 person. So I don't know how to deal with that issue, because we would, based on what you.
I think I agree with Mary. It's bigger than what
We
we
should
could
talk,
cover
we-
in
okay,
5
okay.
minutes.
But anyway, I just want to put that out there. I think that's an important discussion.
I do as well, and I was thinking that, but I figured we
Okay.
we would
Okay.
go forward with Mary's decision. Is everybody okay with that?
I just have one question regarding that too,
Everybody has
just
one
one question more. But we've got, you have to know unmet needs, then what happens next? I mean, how many more steps is there before you actually issue? I think that's what we need to know because we're running out of time.
Let's talk about that as well. I mean, I think we all know, we've had experience with the RFP process. We pretty much know the steps, but of course, as I asked in the beginning, we need help or some guidance that we could have join us at meetings, or somebody that we can call. I mean, not on a regular basis, but we just need some kind of support. And you could think about who or how, and that's one of the things we really were coming in for.
Thank you. Keep us posted how the conversation goes, and then we can brainstorm on our end of, who owns some kind of like step-by-step process that we probably already are using. So yes, keep us posted, and we'll keep you posted on resources as well.
Sure.
This is Alia. I just wanted to.
Aaliyah, we're moving on
we
to
have
the
been talking.
Aaliyah, we're moving on to the next committee.
Okay, I'll just take a minute. Okay, so my understanding is that we are not going to ask OPWDD to give us a layout. We as a council at a local level have to find out the needs, whether we reach out to providers or we reach out to our local FSS coordinators. So that topic should be closed. That's what I want. That's all that I wanted to say. Thank you for the time.
Thank you. Okay, so we did a little crossover, Scott.
Save me some time.
Yeah. So advocacy is chaired by Scott and Crystal Vassler, Mary McGuire-Weeper, Chris Palega, Karen Eichenseer, and Deborah Greif and Jennifer Goldman are committee members. So Scott, will you give us an overview
Sure.
of the work in your subcommittee and some of the concern areas,
Sure.
some more
So
that we had discussed?
Yeah, keeping in mind all these partnerships that we're talking about, in order to get stuff done, yes, you can turn stuff over to us, but we can't do anything without you. You hold the purse, you hold a lot of information we need. And as we discussed, and Alexis, I think this idea of consistency is very important. It's important to us. I know that there are a lot of families out there who join family support hoping to make a difference. They're volunteers, they're parents, they're not sophisticated. They just want to participate. So it's very important to have templates to say, here's how you do an RFP. Here's the information we have for you. And that's lacking, as we talked before. And I was going to talk a lot about that, but I'm not going to. I'll talk a little bit about it. So in the advocacy group, we talked a lot about creating a template for people. Some councils, are high functioning, others are not. Probably most fall in the middle somewhere, but we have a lot of turnover of volunteers. And so creating some kind of template to say, when we advocate, these are the top 3 issues, and to be able to explain to them what the issues are, what we're doing at the statewide level. They could take it or leave it. There are a lot of times there are local issues that are not the same as what we would all talk about. But teaching people how to advocate and using some kind of template to do that at 2 levels. One is with local leaders. We do get a lot of questions locally about family support. Local leaders could be school personnel, could be politicians, could be town supervisors, because all of our families come in contact with these folks, and there are always questions. How do we answer them? How are we doing with family support? We want to be able to advocate. So obviously we get more services, better services, and we meet needs. So that's part of what our group will be focused on. We've met twice. The second part of it is how we advocate to OPWDD. A lot of times they're all over the place. It's very important to us that we reach out to you with concise messaging. I think that Kathy and Gail put together committees just to do that. So that's important too, to have some kind of, and I'm going to say template, probably not the right word, but some way to say, here's how we're doing it, here's what's important, and get all that information out to local councils. For instance, we just talked about data and sharing information from the state to the local councils. A lot of times people show up at my council and other people can chime in. And there's not a lot of information we're getting. A couple of times it was, what are we doing here type thing. We had a lot of new people. But those people, to engage them, we have to provide them with something that's engageable. Now, our local folks, we talk about the ADM, we talk about need, we talk about things that are happening with their own families. That always morphs into that. But we need to be better advocates with you about our local needs. The RFP will help, but there are current services that are confusing and that we need to figure out how do we advocate for our folks in each region with you. And that comes right back to this committee. A lot of the stuff that our committee ends up talking about are the things that we talked about before. Information. Nobody's any good, without information, right? We all need information. The data is very important. Data tells a story. If there's a type of service that is underutilized, we should stop funding it and figure out how to fund something else. Those stories we're not getting. Utilization, performance, dollars, those types of things we need to be able to advocate for services. So anybody else want to add anything to that? I am going to talk a little bit about the $3,000, which is elusive to me. Some councils use their money. I have no idea how to access it. And the couple of times that we brought it up in my council, and other people can talk to, that consistency thing comes up. Wait until we figure out how we're going to use that 3,000 consistently across the state for each council. Do you know what I'm talking about, Alexis? You know the $3,000 issue?
Yes, and
Okay.
so we put that in the bylaws, and we were intentionally a little bit broader, but it does, at the end of the day, connect to the business that the local council is doing.
Yeah.
So what we were trying to understand just at a statewide level, and Nick, Amy, jump in here where I'm butchering anything, but we were trying to just understand what was previously approved and connected to the local business that's being done so that we can support the regional field offices when these requests come in. We're also trying to understand how they were actually funded, because some people had a card, some people had a voucher system. So the operationalization of getting that funding out the door is still being worked on so that we can just understand, is it a card? Is it a voucher program? We're just not entirely sure. But at the end of the day, it has to tie to that statement in the bylaws. So I think there was one request that came up that was kind of portrayed as like a holiday party. We wouldn't consider paying for a holiday party, right? We wouldn't cater a holiday party for a local council that's not connected to the business that's being done or poinsettias, you know? So
Right.
that,
So that's a good point, because I think as you turn that over to us to determine, guardrails are important.
Yep.
What won't you fund? What won't you let us do? That would be helpful.
yeah, absolutely. As soon as I have that list, I will share it. I think we're still just trying to see what requests have come up to get a better list to you, but
Well, why don't we have each council, each statewide member give you examples of what have been approved over the years? I mean, you've been on your council 20 years. You know, even people on 5 years, we can tell you what's been funded. And truthfully, food is an issue. You know, I don't know what, this is pre-COVID, when we would use that as a way to bring families in, come for coffee and bagels. So I don't
Yeah.
know.
I think coffee and bagels are a little bit different than
Okay.
a 3-course holiday meal with
Okay.
poinsettias, you know? So yes, I think if you all have access to that, send it over to Nick. He's already compiling that information, and then we'll be able to give some better clarity on that moving forward. And at least at a minimum, we'll share what's a definite no-go. But we were trying to keep that a little bit more open in the bylaws so that we could move the bylaws forward, so.
I really don't want an allowable and non-allowable list.
We won't
No one
recreate
knows.
that. We will not.
So what I think,
Yeah, no, go ahead. Go ahead.
I just have one question about that. Will you be changing the process on how the money is reimbursed? Because that's where we've recently run into a huge problem.
Yeah, so that's what I need to learn better. That's what I'm unsure of because it seems to have been a little bit of time since that money has been spent. So I just need to better understand. So if you have that information as well, perfect. Thank you. Thanks.
some,
Now, I just wanted to ask another question since you brought that up. Ours goes, since the state doesn't hold it anymore, ours goes to a specific agency. And we, you know, we were allowed to pick the agency we wanted, but then that one was available and was
so
I'm
that's
used
what
to
I was
doing
going
it,
to
so I
tell
wanted
you
to
what
find out.
happened. Downstate has always been told to do things very different than up.
And
way
being
upstate.
being that I don't have that kind of money to put out, they used to allot me 3 months of supply, and then I would do whatever and then send them the receipts. So I don't know, but then I always knew that agency. I had the person in the agency who I'm supposed to speak to and do that. The other thing I wanted to say too is we always have a sandwich at the end of the year. You know, we used to buy the 6-foot hero, but that's it. I mean, it wasn't a party. We would still be in doing business, but it would always be, but that was before. We haven't done it lately, but I'm just saying that's how we used to do it years ago.
I mean, it sounds delicious. Yeah, okay. No, I think as long as, you know, councils aren't saying, oh, we saved $3,000 for this 3-course holiday meal. You know what I mean? Like, that's not what we want to see. So we're happy to give additional guardrails to help you all make those decisions. And that's good to know how you have been getting that money because, you know, it's obviously a big lift for people to be paying that out of pocket. So let us just do a little more research. You share that information with us, and then we'll give some helpful guardrails and maybe a few absolutely nots. But we won't give you an allowable and a non-allowable list.
I'd like to give.
Just a quick question.
Okay, I see. Yep, go ahead.
Just a
ma'am.
quick question. How were you able to pay for lunch at statewide meetings in the past?
Mary, that wasn't through the monies allocated to the councils to do
No,
the.
I'm just curious, you know, I mean, you know, it sets a precedent. Let's look at it from a legal point of view. Doesn't it set a precedent in OPWDD that there are occasions when food is appropriate?
Well, I think we walked away from that, right? And I think reason being here, that's why we're trying to have consistency across the board, right? And I think that's why we've walked away from it, recognizing, right, that things have been done, but when we've taken a closer look, right, trying to keep it consistent and make sure that we're, applying the same standard across the board.
Okay.
And also, it was a longer time frame. The conference used to be longer than 3 hours.
Okay, Scott, I would like to suggest that everyone here work with your local council chairs and come up with a list, forward them all to Scott, and then Scott will coordinate it and send it to Nick.
Okay.
Scott needs to find out who has his money. Also, what agency.
And wait till he sees
No,
what you're
well,
spending. He
I
can
don't think
understand.
an agency has our money.
No,
Yeah.
it's
Yeah.
just
So-
something down.
Yeah, and that's what I was trying to allude that I have no idea how this
Yeah.
is happening right now. So let's just try to get an understanding, and then we'll get everyone on the same page. It might not look the same way. If that's working in downstate to be connected to a provider, then maybe we just continue to do that. But let's just get the level set information, and then we can support moving forward.
Agree. Yep.
Okay, thank you. All right, next up, Deborah Greif is Chair of the Family Reimbursement ADM Subcommittee with Mary McGuire Weaver, Tina Veal, and Gail Pato. Deb, will you please give us a summary of some of the things that you're working on?
Sure. First of all, I want to thank my co-members for your help. I appreciate it. So first I want to say we did meet with Region 4, and because they wanted to understand how they could help us with the information needed to understand the major issues with the reimbursement ADM, because there's been agencies that have been closing, but the reimbursement program has changed so that it's so much harder, we've noticed, for families to get reimbursed. We know the agencies are getting, it's very stressful and very hard for them. So I was at many different resource fairs in New York City, and I did walk up to each agency and asked them, do you have a reimbursement and a program? And they said, yes. So I said, so what's your biggest issues? And one of the biggest ones is this: the changes for requesting justification from your medical doctor. Now, I showed my doctor, because at times he wrote letters for my child and others who have vulnerability. He didn't understand it. And this is a gentleman who's capable of writing. So he said it would be nice if OPWDD could have application instructions for what the justification, how it goes, why the child needs this, either say like a specialized only example, bicycle geared for the child, or a special type of clothing because the child has limited cannot open or close their coats or jacket. There's so many different things. But he would like to see training. And I did, and so many agencies in the resource fairs, and I also went to school fairs, have said the same thing. So that would be a big help if you can have an application instructions for the medical, geared for medical professionals, whether it's the OT, PT, the family doctor, whatever type of medical profession that the child needs to see to justify, who helps to understand why this child needs we need the reimbursement and how this will help the child's developmental disability. Number 2, I've had parents call me and tell me this, and I also been stopped so many times when they see me, whether I'm at a fair, even in the supermarket. My care managers don't know how to fill out the form for reimbursement. That's not good, because I know you've given trainings, but it seems they're not getting it. So what I'm requesting is repeat trainings for application for instructions for the care manager and the parents. If you want to do it separately or do it together, because some parents are really good. We can fill it out. We know how to write out justifications, but others don't. So we're asking if this could be a recurring, we need constant instructions. Care managers they need to have the trainings regularly. It doesn't hurt for the parents, especially the advisory councils, to have the regular trainings and also know when you are giving training to the medical professionals who are filling these forms out so that we can assist to make sure that the reimbursement program will continue to be a program that has been the most popular probably of the family support services because of the help it gives to the families because we try to keep our children home as long as possible. Now, I'm still gathering data, so every statewide member, please ask your councils to send information to me. You can also send it to Gail Pat when she comes back from her second honeymoon so that we can work on this. Because I don't want to see this, I do not want to ever see the ADM for reimbursement to ever stop. It has helped many, many families, mine included. So does any other member of my committee that's up in Albany want to say anything?
I'm Mary McGuire Weaver from Manhattan. I would just like to see if we could have somebody, now that our ADM in District 4, Region 4, has completed a year, and it was told to us that let's just wait a year and see how it goes. So we just finished our year, and I was wondering if someone from OPWDD, not our regional office, someone up here in Albany, would meet with us and have a liaison up here about certain family issues that arise, of things that are allowable and not allowable, to weigh our opinion in on them, because I don't think, I think there's more to be said about things that are on the allowable list and what justification needs to get that, such as a special needs trust. That has come up twice recently at the end of our fiscal year. And things that were put on the non-allowable list, if we could have a one-on-one back and forth explaining our justification why that should be moved to the allowable items. So that's what I was looking for and hoping that you could keep that up for discussion. I'd like to know how you thought the first year went also.
So that's a lot to answer. So first, your understanding of us trying to get a better grasp on things that are on the non-allowable list that all of you, based on your conversations with families, needs to be removed from that list. That was our understanding of the charge and focus of this ADM group. So that's what we're waiting for, is an understanding of things on the non-allowable list that should be on the allowable list. That is what we're waiting for to engage in a conversation about. So when that information is gathered, and I did connect with Kathy on this, there is additional information that we're requesting on the provider side through the provider associations that we're going to have a conversation just to make sure we're pinpointing the right conversation areas, that once we have that level set on the provider side with the provider associations, we're going to share that with the co-chairs, Kathy and Gail, so that that can be duplicated, replicated, and consistent across this board as well, so that we are looking at the same type of information. As you can imagine, we get a lot of feedback, and it's not always in a way that's getting to the point and the meat as to why it should be reimbursable. There's a lot of anecdotal information that's reported out. Sometimes there's misinformation that's reported out. There's myth debunking that we need to do. So I think as soon as we are able to level set on the provider side of exactly what we are trying to get, that will help all of you pinpoint those conversations to share that with us. There's nothing stopping you from elevating that now if you've already started working on that list. One of the things that we heard previously were the noise canceling headphones. That's something that's being evaluated, reevaluated. That's on the non-allowable list right now. So that was really our expectation. So if that isn't your understanding, we should talk about that.
Alexis, Deborah. Alexis, this is Deborah, but I also, we did have I did said this before, and I did testify when we had the hearings and across the state that we need to make sure that we have trainings and explanations to the medical professionals, because before it wasn't required to have a medical professional justify why the individual would need this. And they're very mixed up on how to write it correctly. And that does delay getting the forms through. It is very frustrating to the providers. And this is what's been told to me. Downstate, we have the Interagency Council, and many of them have told me the same thing. I understand we have to talk about the non-allowable list, but that also what I've been bringing up, and also to make sure that the care managers are really understanding how to work with the families so we fill out the forms correctly, because when you don't fill the forms out correctly, that delays us getting anything back at all.
Understood. I think it's just really important that we have this information consolidated in a direct manner. We're not pulling together anecdotal information. It's critical. I mean, what I'm hearing reported out is that we need to have a training for doctors on how to write a clinical justification for family reimbursement.
Well, it never was before, and that's why. It is not, because I will tell you, the doctors even the doctors who work in the developmental disability field are not sure the right way to write it. If there are guidelines or something you want, you need to explain to them what you want. And also, I'm curious to know, why do we need it? Before in the past, we really didn't need that unless it was attached to a device, maybe a metal, but that wasn't covered by Medicaid at all. But they're bewildered because, yes.
Deborah, Mary wants to make a comment.
I actually have to disagree, Deborah, because on the reimbursement committees, family reimbursement, there have been justification letters for certain like swim classes and classes like that, that they've needed justification from doctors and from therapists. So we have been practicing that for a while.
Some councils didn't. And I do understand. They asked us to be consistent. So I know that I've been approached by many of the agencies, and they've said to me, they're waiting for the medical professional to send back the justification. They said to me in the past, it didn't take forever. It went quicker. Now it's
Deborah,
not.
we have another comment, so can we get another comment?
Sure, Tina. You
Scott,
want,
please?
what, Tina? Go ahead.
Scott.
Oh, okay. Thank you. Alexis, so we'll get feedback from families and try and make it more concise for you, or better organized. But you have data. So you have data around what people are requesting that gets turned away, right? Is there any way for us to get access to your data to help us inform? So we have connections with certain groups, but not everybody. But you have that data, and those are big numbers. So if there's an area that you're seeing that people keep applying, that would imply to me a need that we might not recognize through anecdotal information. So I think that would be helpful too. And then the other thing about that we always hear is that when the forms aren't filled out right, or even if they are, it takes longer to get the money to the folks who need it. That might be something else to look at and say, okay, if we're approving at the end of the day 95% of these, why put them through a process? Why not, take the pressure off of you and the family and just get the money out the door quicker? Anyway, 2 comments. Thank you.
Thank you.
I have a comment as well. So I think, Deborah, what we should focus on is the allowable and non-allowables and why we believe that they should be reviewed or considered to switch from one list to the other. So during the break, I'm going to put our email, yours, mine, and Gail's, in the chat. And we ask, I think one way, rather than just our little committee, that we ask family members to email us things that have happened so that we can understand what their issue is. And if they could just put in the subject line, family reimbursement concern. So we'll do that. The other thing is I do want to note, Mary had mentioned that downstate, our fiscal year ended June 30th. And I have just something to share quickly. One large provider downstate, who's a multi-borough provider, has contracts close to $500,000 in contracts. And between 21-22 and 22-23, they paid out $195,000 less than they did the year before. I see even here on Staten Island, in 21-22, we had 163 applicants. And in the following year, this recent year, it was 38. So are you looking at those numbers to say, holy moly, let's face it, that big chunk of money went somewhere and it didn't stay in family support. And we don't want to keep losing that money. So we have to identify the problems. I don't understand why we can't. I wonder if you've looked at other agencies, the ones that closed, how much didn't they pay out during the last year, to just make an observation yourself and inquire what happened.
Yeah, and that's part of
Just as a timekeeper, we've used up the allotted time for this, but we are so far ahead. Do you want to continue this discussion for a little while longer?
Yes, because you cut off the first one by 10 minutes.
I didn't cut it off. I stopped talking.
I knew you would be good remotely.
We are way ahead of time. So do you, as I said, do you want to?
We could hear from Alex.
Yeah, so those are the exact points that we're trying to channel with the provider associations to hear from their perspective. Where are the roadblocks? We obviously know that there's a policy in place to ensure consistency that some providers are not a fan of, that families are not a fan of. So we need to pinpoint exactly where in that process, other than the fact that there are things that are no longer allowable that historically were allowable. We know that that's an issue, but we need to hone in on the process itself as to where this issue is. Are people not coming to apply because they want diapers and know that that's on the non-allowable list? Or are there hundreds of people applying and then the agency is not submitting that? That is what we're trying to gather and understand on the provider side, but then on the family side as well. So that's, what we just talked about, of consolidating that information to put together a full and complete picture from everybody on all sides.
Any more comments?
Yes, I just, first of all, Mary McGuire, I did not, in my borough, we didn't have doctors attached letters to a lot of the reimbursement. Glad you told me that. Number two, I do know that we need, I looked at the non-allowable list and I know it's very daunting, but I also would like to bring up a point that everyone keeps forgetting. Just because a child is OPWDD eligible, but only gets family support service, they will not have Medicaid. And it's Medicaid who pays for the diapers. Their diapers are in very poor quality, and that's been an issue. There is more than one way to go about that, but OPW needs to also understand why certain things may be are not used, because remember, not everybody under the age of 18 has the Medicaid or Medicaid waiver. And waiver doesn't always cover for the diapers and other certain other medical things that may be needed. So my suggestion is that we need to discuss this. And I'm also been in talking with the chair of the HRA committee on the statewide. Senator Roxanne Prasad has approached me about that I'm supposed to have a meeting because we need to discuss the issue in reference with the diapers, not whether the child has Medicaid or not. Anybody else have any other comment? I'm done. And yes, I thank you, Kathy, for putting my email in. And yes, we work together so we can want to give you facts and information, because anecdotes help, but you also need the facts. Thank you, Alexis. Too. Kathy, anybody else wants to say anything?
Chris, did you want to say something?
No, I'm good, thanks.
Okay.
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 Next, we do have Chris up next. Stakeholder engagement. Currently, we don't have a chair, but Chris will outline a couple ideas that may help this committee once it's reformed, going forward on how to support local councils in recruiting new members and statewide roles. And by the way, Gail and I will be reaching out to all of you to see who would be interested in participating on this committee.
Just so I don't get in trouble again, it's now 12:30. We've allotted 20 minutes for this discussion. Is that correct, Kathy?
Yes, we did. So you could let us know 20 minutes and I won't yell.
All right, thank you.
Chris?
We good? Great. So great. Thanks so much, Kathy. To begin, I just want to let everybody know that, a lot of thought and a number of circumstances, including my own situation, have led me to believe that, I can best serve the statewide committee and our community, by being outside of that role of chair of the stakeholder engagement and committee, as Kathy mentioned. Of course, I'm certainly willing, and able to lead any specific projects, in areas that match my skill set when the committee wants me to. And of course, I'm always eager to assist, with stakeholder engagement and outreach whenever I can be assistance with various subcommittees. So with that said, in June, I mentioned the goal of enhancing membership on our local advisory councils. We do have a number of councils who are fully functional, but want to increase their membership. And there's also several local councils who, basically are not fully functional, as you've heard earlier. These are councils who have a very limited number of active members and some who do not have active participation on this statewide committee. I've spoken with a number of members about accomplishing this goal on a statewide level. And earlier this week, I was actually able to share an outline of a potential pathway for accomplishing this with the committee. The draft discusses a number of external and internal challenges to reaching the desired level of participation for each local council. It also details a number of outreach channels, digital and real world channels that might be available for us to employ in the effort. And there's also a brief discussion of how, that effort might roll out on a statewide basis. I'm hoping the committee can discuss that draft in more detail in the near future, but today I'd like to focus on two of our internal challenges. Those being getting councils who are not fully functional to a point where they are, and the need for marketing materials for that really important real world outreach. As leading up to the meeting, one thing has become clear to me that there's a real need to get an efficient and effective process in place to onboard and train new members for councils who are not fully functional. Now that OPWDD regional FSS coordinators are not actively engaging in recruitment, we'll need to develop and implement this process as a committee. We actually have a local council with only one member. We have a council with no members. I mean, these councils can't be expected to onboard and train new members on their own, and there may be others who might struggle with this depending on their particular situation. The solution to this that I've discussed with some of the members and included in the outline is for councils who are not fully functional to begin to collaborate or combine with an adjacent local council who is fully functional. If these council pairings meet together, This will open up the onboarding process for the non-functional council and establish a setting where new members can receive that really important training and mentorship from experienced advisory council members. This will also extend the statewide committee's view of FSS programming into additional geographical areas. On its face, it's a simple solution, but not necessarily an easy one. Some councils will need to take on additional work of oversight and engagement of a larger geographic area. So with that, I'm hoping to hear from members about the idea of combining some councils where it makes sense, and then, of course, from the executive team with their thoughts on that as well.
Anybody have any comments? Anybody in Buffalo?
I just have a quick comment. Okay, Chris, thank you. You're in 4 pages.
Those
of,
are muted now.
Pardon?
Crystal needs to talk.
Yeah, sorry, we were muted, so I couldn't talk. But here in Buffalo, I wanted to say that I'm part of the Western New York region for Region 1. And there's only 2 members of us that for the Southern Council for the region. And we're not considered fully functioning because there's only 2 of us and not 3. There are barriers about how we are actually able to do outreach. And it brings us back to that $3,000 because we need to be able to utilize some amount of funds in order to be able to have outreach pamphlets to be provided to individuals potentially who are, maybe we'd attend events or maybe send it to agencies for them to distribute to people who are receiving FSS, because we desperately need to be able to have more members so we can be independent. But we're fortunate that we're able to still be a functioning council because we're combined with the northern portion of Western New York temporarily until we are actually able to function on our own. But what allows us to be able to work together with the northern portion, we're able to go over the different kind of grants that are being used to do the reviews, and we're able to obtain information about services that people in the northern area are receiving, which actually helps us with our knowledge. So I think a huge part of the stakeholder engagement is to untie your hands and to allow us to be able to do some kind of outreach to individuals receiving FSS funds in order to have more members for the southern portion of Western New York.
So Crystal, what I'm hearing from you is that you've been able to collaborate with your partners in the north, forming kind of a bigger unit and meeting together, and in that way, you're able to have a committee of only 2 functioning and maintaining programs throughout your region, right?
That's correct.
Okay, great. Thank you. Is there any other comments from members?
Can you hear me?
I can't see.
Anyone?
Hi, I'm Mary from Manhattan, and I was just wondering, maybe through the front door session, if there could be a slide maybe to advertise or inform the families coming in through the front door about the advisory council. Prior to COVID, that was our outreach. We would go down to Beaver Street at the front door, open front door sessions, and we would introduce ourselves and tell them what our experience with FSS is. So since we can't do that because everyone in the state can now do it virtually, I was wondering maybe we could give our emails out on slide and give the families the opportunity to reach out to us.
So I can respond to that before I know other people are trying to speak from the committee. We actually do that. Like there was an FSS brochure that was created collaboratively by this group and OPWDD Communications, Front Door. So we revamped a brochure for that to be handed out with people entering the front door. So that's actually already happening. There's not a specific slide with contact information for the local council, but there's a line, and Chris, you can probably speak to this better because I think this was something that you had led. There's information in the brochure about the local council.
And Alexis, there's also in the slide that's used to engage and inform families via the virtual front door sessions that are held. There's a slide in there that speaks specifically to FSS and the role of the council, and certainly, noting to families who may be interested in being a part of that, how to further engage.
Right. I remember working on that front door brochure with Nick and the rest of that team there. I think a lot of it is more generalized information about FSS. And I think what might be helpful for us on our side is a brochure that's specifically designed as a tool to reach out for recruitment, right? Giving the, features and benefits of why we'd want to participate in this, how you would go about participating in, maybe creating a brochure that can be easily like personalized based on local contact information, and people could print it on demand as long as they could use their contract monies, right? So I don't know how much response we received as far as from a recruitment standpoint on that more general flyer that was handed out at front door, but I'm not registering any of it on my end. So I'm thinking if we can develop some marketing materials that are specifically designed to act on recruitment and to enhance recruitment, I think that would be a good tool for people to have, especially, now that we have all these face-to-face opportunities. I mean, the face-to-face interaction with the right marketing materials is an incredibly powerful channel for engagement with families. So that's my take on that, I guess.
I think that's a great idea, Chris. I know when I went to the front door, all the information handed to me was rather overwhelming. And honestly, I don't think I looked back on like some of the pamphlets and information that we received. So I think it's important once families are already receiving services that we have some way of contacting families or having agency contact families for us and let them know about the council now that they have services, and let them know that they have a voice. They have an opportunity to have a voice and make changes or improvement for services that they're currently receiving by becoming members of the council.
Yep, those are all the things you want to include into a successful marketing brochure for sure.
Yeah.
Any other comments about the
may
consolidation,
say
combining the committees?
Excuse me?
Kathy was next.
Chris, when we had the planning meeting last week or whenever we met, this was a subject that was a crossover, I believe, with Scott.
Yep.
About these brochures. It's on your website. And there was a whole discussion on people saying that the contact information, nobody gets back to them. So we were proposing that maybe if we do use this brochure, all the councils were looking for help to have access to them, because it doesn't really look pretty if we print it out on our computer. But also you could have the OPW information, but an area where we could put our local information so that they know who to contact. We could get a number of brochures, and when we go to PTAs or wherever we're going, we can recruit using this brochure as one way resource and have our actual information on it. So I believe, and please somebody correct me if I'm wrong, I think what we were going to ask is to consider printing these in a big bulk at your expense.
Yeah, I mean, there's
not the $3,000. And then somewhere we'll leave a space for our local council contact. Did I get
So
that?
I guess it brings the question, who would pay for this? Would this come out of our 3,000? Or does OPWDD have a funding source that would cover this for us in order to allow us to have a more functioning council?
Crystal, I asked what we discussed was that we'd like them to pay for them outside of our $3,000.
And that would be nice, yes.
Yeah, so let us take the ask back because this is our first time hearing it. I think just on the crisis services side, we also worked with the providers to develop a brochure, and there's a fillable PDF kind of function where they can throw on their logo and they add in their contact information. So we have that model in another area right now. So let us just bring that back. It sounds like you want something similar. You want a placeholder on this current brochure that you can add your local council contact information to act as a recruitment tool, and you want us to print them and send them to you as well.
Yes.
All
There
right.
you go.
Okay, I don't see raising hands, so can I just
Leah,
come
we
in?
can't hear you. Could you speak closer to your microphone?
Okay, so what I am trying to say here is the front door. I'm getting a lot of echoes, so let me. The front door basically is. Can you hear me?
Yes.
Okay, so the front door are very effective for new families, but to get the parents who are already in the system with OPWDD, we need to reach out as a practical, we have to do the footwork on that. Say like PTA meetings in the schools, special schools they have, we should be, get involved with those. Thank you.
Sure, thanks. I'll just add, just a little bit. There are two places that say in the brochure, it says call the 1-800 number, 1866 or whatever. And then on the website, it also has a place to call and you would get a state person. Again, we don't know what happens to those if people do anything with that. But I do like the idea. I think the brochure idea is great, fillable spot. But on the website and the front door, it would be good to have a number and a local contact to talk to, and not a 1-800, number. So I think that's a great idea, Mary, just to get somebody local. And a lot of times, a lot of the local council members are very active people, so they might recognize a name instead of just a 1-800 number. So that just throwing that up there.
Thank you for that. And there has been a recent update. I do believe there was a communication that was sent out to try to centralize communication. So that 1-800 number does route to the local contact at the regional field office. So I know it looks like a 1-800 number that goes into a black hole. That's not what happens anymore. It is rerouted locally to the front door contact. So I don't know, Abiba, if you want to add anything to that, but I know that that's a relatively new transition. So it is just easier to have that one number that people need to know to be able to get connected to the right person. But I don't know, Abiba, if you want to add.
You captured it, Alexis, and we've done our sort of quality reviews in terms of calling those numbers and obviously making sure that folks are responding to it. So if there are issues or folks are experiencing something different, we would certainly like to know that, and identifying the specific regions, et cetera, I think would be super helpful.
Go ahead.
I just want to add to that because I think all these ideas are really, really great. I think part of the issue is that OPWDD is not charged with the recruitment. We are. And that is part of what the missing link is. You may be disseminating the information, but you're not hooking that family into family support services. And I do know that the coordinators in the past, the local FSS coordinators, were the hook. So I think we need further discussion on how do we get that replacement? How do we connect with those families that are walking through the front door, getting the information, maybe even using the service, but we don't know it.
Right. Yeah, and Maria, I think one of the key factors there is being able to connect people who are interested as closely as we can to the local level, so that they can begin to form that personal relationship that will lead to success. I think is a strategy that we should really consider putting at the top. Is there other comments?
Understand you correctly that that 1-800 is on the front door brochure, or is it on?
Well, so it's just in general on
It's-
our website now. Like
Oh,
if you
okay.
go to the contact me, it is the 1-800 number. There's a 1-800 number on the FSS brochure right now. I need to just double check that's the same number that's routing. But what we had talked about was having that local council contact on there, so that's the direct recruitment, because they're going to be calling who's on the council, right? Yes. Okay.
Right.
All right. Got it. Thank
Yes, excellent, yeah.
Any other questions, comments?
Yeah, so I just want to ask of Alexis and Abiba, this idea of councils that aren't fully functional combining and trying to work together at least until they can get to a state where they can be more independent. Is that something that OPW will support as well? I'm just trying to find a way that we're able to take these areas that aren't really receiving the attention from the statewide committee and their councils into the fold, so to speak, right? So I'm just wondering if that kind of collaboration, if only temporary, is something you guys will support.
Yeah, Chris, I think that I recall us discussing this, right? And I certainly think that we would be supportive. I mean, we've really left it up to the statewide council and have certainly, there's latitude in the bylaws, right?
Right.
Around, sort of consolidating and having a smaller number of statewide councils than the initial 19. So I think that we would be supportive of that if folks are as well.
Excellent, great. Thank you so much. I think that's all I have for stakeholder engagement report.
Okay, thank you, Chris.
Thanks,
Okay,
Kathy.
so as Alexis mentioned earlier, the bylaws were introduced at our June statewide meeting with a few changes. We agreed at that meeting with those changes, they would be approved. We didn't have to have a formal, we did it ahead of time, knowing we were going to make changes. So Mary Fasano's the subcommittee chair, Scott Brady, Tina Veal, Deborah Greif.
Great.
I said, sorry.
There's just one comment from the bylaws. The bylaws final product was sent out on 9/14. Reviewed it, and I believe there's one error, and it's under, believe it, under the $3,000 one. It reads, each council will have $3,000 to reimburse members for costs incurred while participating in the advisory council business for all reasonable expenses and operating costs incurred in the performance of their duties. We had said that what should also be included in that section, and I thought was approved at our original meeting, this sentence: in addition, the local council may utilize these monies to meet reasonable operating expenses. That was not included in the final sent out from Albany. I believe it should have been.
I would like to hear from the others. I was under the understanding that when we brought that up, they said it will all fall under the $3,000. They weren't quite sure when we said business, but for us to function, and the business expenses are primarily brochures, maybe some recruitment keychain or something.
We also discussed website, maintaining a
Yes.
website, which
Some
costs
people
money.
use it to maintain their website. It helps them function. Would
So
that
it does,
maybe
it
be
doesn't,
council look
as
at it?
I read it, because the sentence as it stands talks to the individual's performance of their duties. It reimburse members. We're looking to reimburse council expense. That if the sentence I'm saying was eliminated, would cover the council expenses.
Yeah, we
Mary, I
might be
think,
split.
oh, go ahead, Alexis.
Sorry, I was just going to say we might be splitting hairs here. Maybe I'm looking at a different version, but what I'm reading is each local council will have $3,000 to reimburse members for costs incurred while participating in the advisory council business for all reasonable expenses and operating costs incurred in the performance of their duties. So
What the problem, I think, becomes when it says reimburse members. To me, that seems to eliminate the council in general.
Well,
Maybe
they're
we are splitting
members.
hairs. Maybe we are.
They're
I just
members
want to.
of the council,
Go ahead.
right? Like you're connected to the council. So that, I think that was the
So you think
default
you think it
understanding.
would be covered? Okay, yeah, all right, I can accept that.
But Mary Beth, let me know if I'm off base here. And Abiba, sorry, I think you wanted to say something too.
No, you captured it, Alexis. That's exactly where I was going to go with this. It's you're performing the duties of the council, right? In terms of recruitment, stakeholder engagement, information sharing, right? And we would see that as a reasonable
Okay,
expense.
all right, accepted.
I'd like to also add, as a reminder to our statewide members, you all received the finalized version of the bylaws. It is now up to you to reach out to your local chairs, explain to them. You might want to sit down with them. You might want to join them after a meeting so you can explain what the bylaws mean, because in those bylaws, the local councils will now be required to develop their own bylaws. And it specifically tells you what needs to be done, and also take the same time to take the opportunity to go over that conflict of interest and come and operationalize how you're going to do it, how are you going to be kept informed as they get new members, and help them understand it's really, really critical that new members sign those forms. Yes.
I just have I just have a quick question about that process. I know when the bylaws for us were first, for the council were developed, there was back and forth with legal, I believe. So as we develop our local bylaws, how will that process be, reviewed to make sure it's compliant, from a legal perspective?
So I don't want to put anybody on the spot right now. Perhaps that's something we can bring back and just discuss with council to see what makes the most sense. I'm not sure what the level of involvement is legally for the local council. So let us just take that back, and we'll bring that to the next meeting, if not in between electronically.
And should the local bylaws be consistent, right? Every council's going to have one consistent document, as opposed to each council developing their own, right? Because
I believe it says that they do it on their own, but maybe it would make sense that.
I mean, if we're looking for consistency, I don't know, I'm just putting it out there, but.
No, I think I'm going to disagree. I think the local council, within the guidelines of the state bylaws, should be able to develop its own, because there are regional differences and regional needs that could possibly, that could be accommodated in the local bylaws. I think one thing does not fit all in this instance.
I agree with that too.
One other thing I wanted to mention too is that a lot of us have our own bylaws that we've had for years, and we review every 2 years. We do a bylaw review and another vote on it and do make any changes to it. So I'm just hoping we can.
And just Tina, and just review them to make sure that they're in compliance with the statewide mandates.
Yes.
And that's, yeah.
Yeah.
And I think that, it needs to be done at a local level because of local differences.
You're okay with that?
I'm okay with what you're okay with, but we'll
You're
loop back.
so agreeable.
I
Must be
mean,
Friday.
they're not my bylaws, right? They're yours. So you have to be comfortable with them. And then we can just check with council if there's any type of legal involvement that we are obligated to have.
So before we say that the bylaws committee is no longer needed, I'm thinking, Mary, if you could send out an email to everybody, and those who have bylaws, send them to you. And then you could send it out, because some of us don't have bylaws, and why reinvent the wheel if we could take something from another council?
Okay, will do.
I just want you to stay on forever.
No.
Yeah.
The clock is ticking, my dear. Okay.
Okay, so
Kathy,
Mary,
this is
how are we on
probably-
time?
Sorry, Kathy, this is probably already known, right? But I think it's noted in the bylaws that, each council can establish their own bylaws, but we've outlined, a minimum of what should be included. So I just wanted to note that.
Okay, thank
The
you.
time, well, it's now 1 o'clock. So we
Mary,
are.
can I get 30
Okay,
seconds?
we're ahead of schedule.
COI?
So how about we do 15
Hands
minutes?
up, hand raised.
Wait a minute. Too many people talking at once.
Yeah, so if I could just get 15 seconds on the COI. The people are still having a challenge, some people, of how to exactly get those filled out right so that they make sure they're doing all the right things, right? So I'm wondering if it might be, I know there's some information in the COA document that discusses, what the requirements are and what you should think about. But I'm wondering if maybe council's office might get together
Wait,
with.
hold on
you
a
know,
second. Manhattan, could you mute? Thank you. Now, Chris, I didn't hear, I don't know if anyone else had, we didn't really hear what you said, so can you please repeat?
Sure. I mean, the COIs, getting COIs executed has always been a challenge. And I think a lot of it is people understanding, what they're signing and how to best fill it out. I know there's some guidance in the COI document. I know I worked with council's office through that initial process and trying to get some more guidance out to people and sharing that. But I'm wondering if some people might want to get together maybe with council's office and try to develop a more detailed guideline about completing that COI. And I think maybe having a better understanding of what it's all about, what you're signing, and how to think about it really clearly might really enhance, the speed at which people are able to execute that document. Thanks for the time.
So I would just say,
Go ahead.
sorry, I was just going to say, to make it a little bit helpful to understand what the exact questions are, if you can elevate those to us, that would be really helpful. There's obviously background information in the bylaws that better puts context around why the COIs are needed. There's information on the COIs itself. So if there's something that's missing from the bylaws and missing from the COIs that still needs clarification, just send us those questions. When I say us, send Kathy, Gail, and myself those questions, and Nick, so that we can just coordinate with council and understand what is still unclear based on the resources that we already have out there.
Great. Yeah, I'll see what can be done on that. Yeah, it's okay. Great. Thank you, Alexis.
Alexis, this is Karen in Buffalo.
Hi.
Hi. I was going to bring this up later, but it's in the bylaws, so I'll bring it up now. Under Article 4, local advisory councils and what our duties are. I don't want to read the whole thing over because everybody probably has that document in front of them, but under our duties, it's to provide input to new contract renewal negotiations. And there's several different parts in there that it has us working directly with our DDROs, providing them information. Do you realize that the DDROs in our region, Region 1, Finger Lakes, there's a disparity across the state on what kind of engagement our DDRO reps are now working with our locals. When I first started on this council, there was a ton of engagement and a ton of questions and update on the contracts and the utilization and all that. I know we've talked about this before, but we are getting zero of that in my local. We did not even go over contracts this year. We are being told by our DVRO representative that they no longer are engaged in that. It's in direct conflict with what this document says here that we are supposed to be doing. Every year prior to last year, we sat down, we went over them, we were invited to the meetings, we could go on the annual reviews with them. There was none of that this year or last year. So some of our statewide members say they are still getting that engagement with their DVROs, but a lot of us are not. Are you aware of that?
Yeah, Karen, thank you for flagging it again. That's really what I was speaking to when we first started the meeting, was understanding that there is inconsistency happening right now. And what I'm trying to do is focus on the structure so that there is consistent information being shared with all the local councils. And that includes the information about the contract. So Nick is going to speak to that a little bit further after our break on program implementation updates. But I am very aware of that. We are going to be responsive to that. It's all about better understanding the exact list of things that will be helpful for you to function as a local council. So, you know, what I've heard loud and clear so far is that Rolodex of FSS contracts by program area, the amount that's funded, and there needs to be additional conversation about what that frequency of sharing that connected to utilization so that the local councils are aware where there might be underperforming contracts or underspent contracts, all of that. So that first step was to get these bylaws in place to get us all on the same page. And now we're working from the same page. So it's about building structure from the bylaws, which we now have. And I thank you for calling attention to that and just threading the needle to what I was trying to start the meeting with.
Okay, and just as a further comment, I'm also a broker, an independent broker for the Self-Direction Program, and our first quarterly broker training was just this past week, in which at that meeting, OPWDD spoke no less than 9 times about referring people to the FSS programs right out of the front door sessions, because the cure managers have been trained now on the waiver. You know, when people apply for the waiver, you've had some updates to that waiver application process. So I have a lot of concerns that the care managers from this day forward, from when they were trained late summer, will be directing all of these people toward the, you know, Family 1 area was mentioned, the family support services. There are others, of course, but I expect with that new, training for the care managers that we should see an uptick in the use of the family support services programs. But at the same time, we here at the local level, council level, we're in limbo on looking at these programs or looking at any of this data, utilization data, while we try to become, across the state compliant with each other. That's a concern.
Thanks, Karen. That's a lot to unpack. That's a lot of information, and not everybody sitting around this table is part of the conversation that you're referring to. So I think it would be really helpful if there are specific questions that you have as a broker related to the quarterly FI broker training that you were a part of. Please make sure that that is submitted through the self-direction mailbox. If there are questions about FSS that are connected to that training, please share that with the co-chairs, Nick and myself, and Chad, so that we can just make sure that that's addressed. I just want to be cognizant that not everyone at this table is at that forum, and that's kind of where misinformation can be shared. If we're all kind of hearing this at a different point in time, and this is all through somebody's perspective and lens, right? And we don't have enough time to focus on a training of what was discussed at that FI Quarterly Broker WebEx. So I think if we can just have those channels that are already in place, if you can share the questions there, and then I can talk with Kathy and Gail about a level set, because I think that people are going to have some questions based on what they just heard, and I want to make sure that we're getting all of the correct information together.
Good, thank you for that. Yep.
Okay, so it's time for break. It's 10 something, 1:10. All right, so if we could all be back here at 1:25? Okay, 1:25? Commissioner Neifeld will be speaking at that time.
Hi, everyone. It's Josie from OPWDD. I just want to call everyone back and make sure we get our conference rooms back online.
Okay, so we're back, and now we're going to hear from Commissioner Neifeld, her report, and I'd just like to welcome you back to the statewide. We haven't seen you for a number of months, and congratulations. And how's the baby? And can we see pictures
Thank you.
before you leave?
Sure, yeah, happy to put my
We should
my
put it
child's
on the
picture on a public
screen.
meeting. I could, yeah, next time I'll join virtually and I'll bring him with me.
Okay.
I'm kidding.
Bring him here.
Sorry, so I left my paper copy of my talking points in my car, so I'm going to try to read it off my laptop, or use my laptop to prompt me. So I'm awkwardly balancing the laptop and the microphone over here. Maybe get rid of the stand. So yeah, no, thank you for having me. It's great to be here. It's great to be back. Yesterday we had our DDAC meeting, and today FSS. So it's nice to be back into the swing of things with these really important groups, and want to acknowledge obviously the incredible work of the team, Abiba Kendo, Alexis, Chad, Nick, and Amy, and then also, Jessica Pigeon and the Office of Strategic Initiatives for working to really align with the committee work that happens here, with everything that's happening with the strategic plan. And that, I know that there's been a lot going on with FSS. And I think that we have a really truly committed team working on this with you guys. And it's been very interesting to be here and to hear the discussion, and to continue to support the really valuable ways that FSS supports families and people with disabilities across the state, while also bringing statewide consistency of practice and standards into how we do business. And so it's really nice to see the collaboration between the local councils, the statewide council, and the agency. So speaking of the strategic plan, I think everybody knows we held stakeholder engagement forums this past summer. We held 10 of them. Most of them were in person. We also held 2 virtual. We had over 900 participants and almost 200 speakers. We provided a brief update of the plan, and really the most of the meeting was open for public comment, for folks to be sharing with us how things are working or not working, what are their thoughts on our progress with the strategic plan to date. And we also provided this opportunity, this round, we had an opportunity for an online survey, and we received input from over 2,000 stakeholders through our survey process. So we're really, every cycle that we go through. We're continuing to improve the way that we engage with people, continuing to provide multiple avenues. Oftentimes we have a lot of folks who will come to a in-person forum, but maybe don't want to share, right? And they just want to be there to hear the dialogue and then provide their comments later. And so the online forum or the online survey tool provides a great opportunity for that. And the online survey tool had questions. So we had, very specific pieces of quantitative information, but then also qualitative open opportunity for people to share freely through that survey. So that was great. Very grateful for everyone who participated. And we know that many of you, either you personally or folks on the local councils, participated because we did get a lot of feedback about FSS. And what I'm gratified to hear, right, is that the conversation that's happening here at this committee meeting really does encompass the feedback that we received through the stakeholder engagement process. So the concerns, the questions, the thoughts are all part of the discussion that I'm hearing here happen. So that's really great. And we've been working really hard to ensure that we're directing people who have feedback, who have questions, who have thoughts to their local council, so that information can filter up to the statewide council, and that the statewide council can sort of be that conduit to the OPWDD team to address anything that is coming up, questions, concerns, and also, feedback on what's working. So that's always appreciated too. And then just on the strategic plan, we'll be issuing in November an update to the plan and describing our progress to date and, confirming our continued action going forward. So you'll see more from that. And we obviously work very closely with the DDAC, which you all know you are a committee of the DDAC as well. So a lot of opportunity for collaboration there. Just a few other things to note before we get back into business. In July, we marked the anniversary of the Americans with Disabilities Act by launching a year-long anti-stigma campaign. We had a joint press conference with the Developmental Disabilities Planning Council. Kim Hill from the governor's office came. We unveiled the Remembering Willowbrook documentary that the DDPC created. And if you haven't seen that yet, I would really encourage you to view it. And actually, it's going to be screened on PBS, I think next week, and we can find that information and try to share it with folks, because it's a really great opportunity to watch the documentary. We also unveiled an exhibit in the concourse that was on display in the plaza here called Beyond Willowbrook, and it was a visual timeline of the events that led up to Willowbrook and then events that have happened after. So it was a really powerful way, I think, to commemorate the anniversary of the ADA and to continue to shine a light on all the ways that people with developmental disabilities contribute to our communities and to society, and to continue to sort of break down those walls and those silos and those stigmas. So we're really proud of our communications team for that campaign, and that's all available online if folks are interested in it. An area of great interest for many of our stakeholders is managed care and the continued discussion about the possibility of how managed care may or may not facilitate access to services in our system. I think folks know we've retained a third-party vendor to review that question, to review opportunities that may be presented through managed care or not. And so as the next step in that engagement, our consultant is Guidehouse Inc. That's who we've retained to do this work with us. And Guidehouse will be conducting a series of town halls. Starting next week, we'll have 2 town halls that will be specific for providers. And then in the following weeks, we'll be hosting 4 additional town halls that will be for people with developmental disabilities, their family members, and the general public, anybody who's interested in dialoguing on this. So those town hall discussions they'll start off with a brief presentation from Guidehouse. There will then be an opportunity for large group dialogue, and it will be 2-way bidirectional dialogue on the topic, opportunity to ask questions, to voice concerns, and to have and to hear responses to some of that, or to have a dialogue on some of that. After the large group discussion, we'll break out into smaller breakout groups and be able to have an even smaller discussion, which can often be a little bit more productive than a large group discussion. And again, because not everybody is a fan of speaking in large groups or at town hall type forums about their opinions or asking questions, even though no questions are dumb, people often don't want to ask questions. And managed care is a really complicated topic, and people naturally have a lot of questions. We'll also be using an online-based survey tool to collect people's thoughts, feelings, concerns, fears, excitement related to the topic. And we're very intentionally trying not to just ask, black and white questions like, do you want managed care or not, right? Because I think that, right, they're not helpful. I think a lot of people don't even know the answer to the question and need a lot more information, need a lot of dialogue, need a lot of conversation before they can even answer that question. And what we're really trying to get to the bottom of is what's working and what's not working, and whether or not managed care would potentially be a vehicle to facilitate some of the transformation that we're trying to push in our system. So a lot of opportunity there, and I encourage folks to register for those and attend and contribute however you feel comfortable contributing, because it's really it's very important that we hear what folks are feeling and thinking about this, and that we have that dialogue so that we can formulate the right policy answer. So that's up next. And if you have any questions about that, you could probably Google like OPWDD Managed Care. We have a whole website set up with materials there and also links to register. Just a couple of updates on some of the workforce projects that we're undertaking, which I think are really important. We all know, right, that the workforce challenge is huge, and it's a top of mind for all of us. We've been talking for a while about our ARPA funds. Everybody knows we invested the vast majority of the money that we received through the American Rescue Plan Act directly into workforce. A lot of that was bonuses to staff, but a lot of it was also grant opportunities. And we're really starting to see some outcomes from those grant opportunities, which we're very excited to continue to share with folks. So we've been partnering with SUNY to develop a micro-credential program. And so we're now collaborating with 13 community colleges across the state to offer a micro-credentialing to students or existing DSPs. And what we're seeing is really great that, we've been partnering with our providers in the area that the community college is in. And so they've been providing some existing DSPs who want to take that micro-credentialing. They're getting the benefit of having the opportunity to do that on campus. They're getting a stipend. They're getting to be part of the community college community, which is all wonderful. But then we've also seen existing students who are not currently DSPs working in the field see a micro-credentialing opportunity and be interested in it, which will hopefully lead to employment, right? So I think what we're doing is professionalizing our existing workforce and also attracting and recruiting new folks to join the workforce through this exciting opportunity. And we're really excited about it. We're really grateful for SUNY's partnership. Most of the 13 schools that have started the micro-credentialing are having wait lists already. So we're looking for ways to continue to expand that. We've also been partnering with the National Alliance for Direct Support Professionals to expand an opportunity for existing DSPs, not through a SUNY, but just through the National Alliance for Direct Support Professionals, to provide an opportunity for existing DSPs to also be credentialed. So just continuing to work on that professionalization of the workforce, helping our workforce develop the skills to deal with the difficult situations that they're faced with every day. We have more than 700 staff who have received those certifications so far. We allocated enough funds to provide opportunities to 2,400 DSPs, and more than half of those slots are already full. So we're really seeing a lot of uptake with this, and people are really satisfied and gratified with their experience that they're having through that. We also are undertaking a technical assistance in work with the New York Alliance, and what they have done so far is done an organizational self-assessment for not-for-profit providers, and actually we as a state-operated provider also participated in the assessment. And then there was a companion survey for DSPs. So the provider did an assessment, the DSP did a survey looking to understand what does the provider understand about the workforce challenge, and what is the perspective of the DSP, and where are those the same, and then also more importantly, right, where do they differ? And what it does is helps to provide insight and opportunity for us on how can we work differently that will hopefully help us to retain our very talented staff, to help recruit more staff, and then also what are the opportunities for training, for professional development, for staff development that we can see. And so we've had more than 3,000 questionnaires were filled out by DSPs, and a third of our providers completed that survey. And so out of that information, we'll be developing more technical assistance and trainings. And so we're really excited about that. And also excited to announce, and under Alexis's shop with a different talented team of folks, we've just recently announced that we're awarding, actually, I think it's being announced today. The governor is making a press release, so we're announcing today. You guys get a sneak peek. $13 million in grants to 8 not-for-profit providers across the state. And that's money that will be spent over the course of the next 4 years. And it's meant to facilitate people with developmental disabilities to continue skill building so that they can seek employment opportunities. And it really is sort of gap filling funding, right? It's not stuff that is covered through our existing continuum of employment programs. It's providing opportunities for people to develop training and skills that is not covered already. And we're really excited about this. And obviously a big push and a big priority for the agency is to help people seek employment wherever possible. So this was a big exciting thing for us, and it was a priority of the governors and the state 2 years ago. So we're announcing that today and very excited about it. And then lastly, for folks who are in the region and who would like to participate on October 3rd, all day long here at the Plaza, the governor's office is hosting the DREAM Symposium. It's the New York State Disability Rights and Employment Awareness Month Symposium. We'll be talking about a lot of the great work that we've been doing related to employment opportunities for people with developmental disabilities. There will be businesses there. All of this is designed to help continue to talk about employment opportunities for people with all types of disabilities, to help employers to understand the value of creating inclusive work environments, what the benefits are for them, what the incentives are for them. And it will be, like I said, it's supported by multiple agencies, so OPW, OMH, the Department of Labor, SED, lots of folks will be there, lots of local businesses, and it's open to people with disabilities, their providers, their families, their circles of support. And we would love to see you participate in that as well. So that's just a snippet of what we're up to. I had planned to go quickly because we had a packed agenda, but everybody's being very efficient this morning. So happy if people want to ask any questions or have any comments, or we can just move on. Up to you.
Any questions? Ann?
I'm wondering what can be done or is being done to address families that are in imminent crisis, to expedite services that are really needed in a crisis situation, and not having to wait really long periods of times?
It's a great question. I don't know if it's a 30-second question, and we can certainly have more conversation offline if you want to, but I think what we're doing is a lot. I mean, I think starting with some of the work that we're doing on workforce, a lot of the issues with access to services is a result of some of the challenges with workforce. And I think as we see, right, our providers are being stretched thin. And even within state operations, right, that challenge of being able to meet some of those very intensive needs. And I think that's what you're talking about, it's becoming more and more of an issue. So we're doing a lot in terms of supporting our workforce. Under Abiba and Alexis, right, another thing that Abiba and Alexis do is, working on a lot of the crisis programming, CSIDD, making sure that CSIDD is available statewide. We have lots of interesting work going on with the Office for Mental Health to understand where we can collaborate with them on dual diagnosis. We're piloting a home-based crisis intervention program with the DDPC and with OMH that's specifically for children who are in crisis, helping to keep them in their homes and keep that crisis from escalating to what we see as hospital placements, emergency department placements. We're doing a lot of work related to just administratively how we're processing, the people's need for housing opportunities, and working, very collaboratively with the providers, and hoping that will create a more expedient process for people to have opportunities made available to them. So there's a lot going on. I don't know, Alexis, if there's anything that's coming to the top of your head that I should mention now, but not to put you on the spot, but.
No, I think you really covered it. It's just a continuous look to understand what the current need is and where we're not able to connect, whether it's, a provider is at full capacity or does the provider not exist? It's a really loaded conversation, but making sure that that's communicated with the local regional field offices, making sure they understand the unmet needs, and also if there is a care manager in the picture, ensuring that they are communicating what those unmet needs are as well. I don't know, Abiba, if you wanted to add anything.
I think that you both captured the highlights and the important components, right? I think that we've made a commitment to continue to look at and evaluate our resources, right? I think that folks know that in the 507, we've outlined, crisis supports and housing supports, et cetera, as a priority, and we'll continue to look at capacity issues all around, right? Alexis referenced provider capacity, staffing issues, to try to make sure that services can be authorized more timely as we move forward.
Thank you.
I'd like to say thank you to the commissioner for this. I'm absolutely thrilled to hear about this credential program across the state, and thank you for that. That is much needed, and it's a great thing to see that there's finally going to be some progress made toward that worker shortage. Thank you for that.
That's Karen.
Hi, it's Deborah. Commissioner, when you're having the the symposium, I'm concerned to please make sure that, and the OMH needs to understand that when individuals I would like to see them working, but I don't want to see them lose their benefits or medical benefits is what I'm concerned about. So please, can you please see to it that there are staff there that can help explain to them too, that if they go to work, how do they report if they're on SSI or SSDI, so that they can keep their Medicaid, which is a very important because they do have also pre-existing conditions. So that's a concern I have.
Thanks, Deb. It's Alexis. I did coordinate with Kim Hill to just make sure that some of the resources on site are capturing some of the myth debunking that needs to happen around benefits. So that should be a resource on site. There was also some discussions around, resume building on the spot, having staff there that could help with that too. So that should be there. It's supposed to be a really great, lively event. There's going to be some workshops, but those resources should be on site, if not a contact to be able to alleviate some of those concerns about benefits.
Deb, put your hand down, please, if you're done. Thanks. Okay. Okay. All right. Next up is, I guess it's Kevin. The fiscal update, or will it be somebody else?
Yeah, somebody from fiscal. They're gonna I think we're covering the travel reimbursement policy outside of this. So no update on that, but there is a slide that they wanted to present related to the RFA allocations that we've been talking about.
And this just goes back to the RFP subcommittee who asked, we all had received a breakdown last year, the allocation by region. Now we asked for Kevin to come up with the allocation by local council. So what you're going to see up here is a allocation by each local council.
So I think it's Christine.
Hi, it's Christine Carey. So I think if we could advance the slide, please. So what you're seeing on the screen here is the original allocations that were given out by region. It's the 3.5 million, and it was based on, the percent of individuals living at home in each region. And then if you advance to the next slide, it's not really new information, but what we did at your request was we broke it down by district. So if you were to add up for each region, the percent or the dollar allocation, if you were to take Region 1, Western and Finger Lakes, for example, that would add up to the 18.2%, and then the, 336 and change for the allocation. So we don't really have much more to give you or present to you other than that today, but we're open to taking any questions if you had them.
Any questions? Metro's Bronx and Manhattan.
I-
Go ahead.
yes.
Sure, Scott.
Just the, so the allocation, just to be clear, is based on individuals living at home in each region. So there's a formula, that regional weight is that,
Correct.
that's the, okay. And how do we get that number? Is it only people engaged in, obviously, with OPWDD, right? That's my own question.
Yes, it was pulled by our data unit, and it was all the individuals living at home. And then what we did was we took them and we weighted them by district, and then we had rolled it up originally into regional, but we are giving you the lower level detail now.
All right. Well, that's great. Thanks.
So the reason why the RFP committee asked for this information is because another thing that we're trying to figure out, how we want to distribute the money. Do we want to keep it in that one lump sum by region and then have each provider put in an application for whatever, wherever they want to provide the service? I mean, it's a thought. Or do we want to do it down by individual districts? So that'll be something we'll discuss further as we move on with our subcommittee. Okay. Next, I believe now we're going to hear from Nick.
Sorry, can I have one quick question?
Sure.
On the slide that's up, the FSS RFP allocations, is it possible to get the head counts behind those regional weight percentages, the actual number, so that we can have kind of an idea of what we're talking about as far as like a head count?
I think we had discussed that previously, but we can look back at my notes and I can see if we can pull the detail up, and see how long ago it was pulled.
Yeah, it's a number I've always been curious about. Thank you.
Thank you. Okay, so Nick, you're going to give us a CCO follow-up update on the training?
Yep, I'm gonna go over a few things. Can everybody hear me okay? All right, I apologize. I've got a little bit of a cough, cold, something my kids gave me. So if my voice sounds like this, that's why. Yeah, I know they really are. Can you move to the next slide, Josie? So this first slide, yes, as I'm sure you all recall, we provided training updates, informational session on the ADM on May 30th. The recording of that training and the PowerPoint that also was part of that training is available on the website. And by the website, I mean where you can find everything FSS ADM related. We're continuing to grow that section of the website, as I'm sure if you've looked at it lately. We are working on translated versions of all of the reimbursement applications, or I should say, we are working on translated versions of the reimbursement application. Currently, we have the English version, is definitely there for everyone to use. The other versions that are still on the website are prior to the changes we made to the application. So once we do have the translated versions available and they're on the website, we will let everybody know, of course. The reason that it's taken some time is partially because there were one of the check boxes that's on the current application on the English version wasn't working right. So as I'm sure it won't come to anybody's surprise, of course, one step in this process is getting the translated versions done. The other step is making sure the form actually works for everyone. So there's why I'm still telling you that it's still in the works, but it's being worked on and will be available. Then the second part of my update around these sessions, we obviously got quite a few questions, comments, things from that session back in May. And we took all of those comments, questions, concerns, reviewed all of them. And we realized, there was a good subsection of them that were overlapped with, the CCOs, whether they were questions from care managers or about, care manager related things. So we took that to our CCO team at central office, reviewed those questions, and we either the CCO team has reached out to people and done some direct responses. And then we've also been directly responding to some of those questions over the last couple of weeks. I should say I mean Amy, because she's wonderful like that. And we also will be, depending on how the questions sorted out or the comments, we definitely saw some groupings of things. Like I said, I think in general, CCO care manager related questions were a big part of it, but we also were able to go through and tease out some things that we need to add to the FAQ document that's on the website. So that's the next step. We're taking that document, reviewing it again, either adding to it. There may be some entirely new questions and answers, or maybe modifying some of the answers on existing questions. So that's another thing that as we continue to update the website and add this additional information, we'll make sure everyone's aware, and that being obviously this group as well as the regional office staff. Can we move to the next slide, Josie?
And Nick, just to give your voice a break for a second,
Thank you.
there was a question that came in about needing translated applications. If we do not have the updated translated application on our website, can the old version be used? Absolutely. We're not going to hinder someone from being able to submit an application because we haven't had it translated yet. Thank you for asking that.
Yeah, and I was just going to say the updates to the application were pretty minor, so it certainly shouldn't impede anyone from applying, even though we're still working on those updates. The next slide. This is some follow-up from our previous statewide meeting back in June. And I think, as Alexis has already alluded to several times, we are aware that there are information requests coming from all of you in terms of really two different things. One of them we have addressed. The first one being these program directories. So I think, and correct me if I'm wrong, Kathy, you probably know better, I believe in August, we sent out each regional office, but really it's broken down by each district, has program directories that they maintain that has all of the FSS programs, not just family reimbursement, but every single FSS related program. We sent those, or we shared those with Kathy and Gail. And so that was
And
one half of the
that's
ask.
what we spoke about it during the RFP. We've been using that to
Right.
work on our goals.
Yes, and that was the intent is
Thank you for that.
you're welcome. That was the intent was, obviously it makes sense for you to have that information so you can see, well, not only what's going on in your own district or region, but also, some of the programming and things that are going on elsewhere that may be something that, you may see as a need, or maybe, like I said, maybe of interest to replicate, in your local area. So the second piece of it is around contract fiscal information. We put out a request to the regional office staff to collect all the FSS contract information. We just received that back in the last few days. So we need to spend some time reviewing that, analyzing it, and determining, as Alexis mentioned, and determining the best way to get that all to you, and also a frequency that makes sense. And part of that being I know, people would like updated information as much as possible, but we also have to balance that with the fact that, that the RO staff are the ones who have to compile that and do all of that. And we also have to keep in mind that we have different contract periods. So as we mentioned, Region 4 is different than the rest of the state. So to say like, we're always going to do it at, we'll say, these points of the year, it may not make sense, for everyone else compared to their region, compared to the workload of our coordinators and our other RO staff. So those are things that we have the information and we on our end need to look at those things and get that back to you. But it also ties back to what Alexis mentioned in terms of everyone letting us know, specific things that you need to be able to function as an effective council. So I think it's still important to get those specific things so we can look at what we have, look at what you're asking for, and give you what you need to be able to function effectively. Stop there if there's questions before I move on.
And
Yes, I have a question. In the past, I understand the contracts are written for 5 years and they've kind of automatically turned over repetitively. And I'm wondering if that has changed or will change as that kind of automatic rollover. And as long as they're meeting their outcomes. So I'm just curious.
I mean, I don't know if I can exactly speak to that. I do know what you're talking about. Yes, contracts are usually 5-year periods, but even within that 5-year period, there's usually there's an annual review that goes on amongst those two, and that's some of that the program review work that's done ties into reviewing contracts. But I don't know if anyone fiscal or anyone else could speak to that part, but I'm not sure.
So it could maybe technically be a contract for 5, 10, 15, 20 years, the same contract, as long as it's meeting its reviews. So I'm just wondering, because times change, how that's adjusted or looked at.
Yeah, and I think specific to the FSS contracts, right, we would expect, right, for, committee members in concert with our coordinators, right, to be reviewing the programs and identifying any issues or concerns, right, whether those contracts continue to meet need, right? I think it was you that referenced early on that there are some contracts that are no longer meeting the need. So to the extent that that's the issue, I think we would expect to understand that, right? So that appropriate action could be taken. Of course, following the terms of the specific contract, as well as the terms outlined within. I think we would need to know from those reviews whether or not they're meeting the expectations and certainly able to meet need as identified by committee members.
Is that other questions?
So we talked about the data, and you're going to work on that with the frequency and some way to get it standardized, right? Right.
That's the intention.
Yeah. The review thing, I know reviews go on annually. I understand the 5-year contract issue and yearly reviews. Can we also have access to the reviews? I know a lot of times people participate, right? We haven't really in our region, number of reasons, nobody's fault. During COVID, things kind of came to a halt. Bunch of stuff, conflict of interest stuff, but having access to information saying whether somebody's performing, they're in compliance, those are issues too that I think would be helpful for us to see. Or no?
Well, I think, and I mean, someone correct me if I'm wrong, but I think it's ties to the bylaws that there's definitely mention of council members are able to participate in, some of that program review work. So I don't know if, like I said, it sounds like you're saying it hasn't necessarily been happening.
Well, two things. So even if it doesn't happen, right? Or if it does happen, having access to the review. So all these folks are volunteers. And I know my wife used to say, she's been active longer than I have, that reviews used to take place at the convenience and when the volunteers could do it. I don't think that happens now. I think they happen and we get invited. That's a different thing, right? If they work around the volunteers, that's one way of doing it. And I don't know if that's a COVID related thing. No? Okay. So
Yeah, I
I'm
think
sorry to
they're
interrupt. This is what I was talking to earlier, is that the reviews used to take place at a time that was convenient for the members to participate. Now that it's moved to a budgetary review more than a program review, we have been invited during working hours, which makes it impossible for our members to participate since they're all working. So we don't have access to the information if we don't go physically to that review,
yeah.
right? I
Yeah,
think that's what
what
you
I'm-
were alluding to.
And I know Abiba has some historical information on this, so I just want to give her a second to chime in.
Thanks, Alexis. I think it just goes back to the conversation that we were having around consistency, right? I think there was a comment made about things changing post-COVID, so to speak. Certainly, there were a number of councils that were participating in those very specific reviews. And when you're participating in those reviews, there's sort of the reviewing of documents, individual rosters. There's a document that the FSS, quarterly report where you're documenting progress, activities, accomplishments, any problems encountered. And then there's also the physical on-site observation of the program, right? I think we're going to have to, do an inquiry and just sort of understand where that's no longer happening around the state and where folks are interested in resuming and what that partnership looks like. But there would be an expectation that you have information to review in advance, right? To understand the terms of the contract, the purpose of the program, and whether or not that provider is meeting the need, right? As evidenced by your review of rosters or even some of the program specific information, as well as the observations that would be taking place.
I'd like to just comment, when we did site reviews, it was based on when the program was operating. So if it's an after-school program, it's going to be 3 o'clock. Some extend till 6, so maybe it could be coordinated if people work till 5. But the other thing is there is a difference between seeing things on paper and then going out in the field. We've had to pull contracts from providers who, things that parents pick up, scissors on the table. It's like, oh, no scissors on the table. Just little things, Clorox on the floor. And those are the things that we would pick up and possibly at times they would lose their contract. So the site visit is really important and it's something to consider if a program is held during the evening anyway. It should be done because, we have, what?
No, I wasn't referring.
Oh, I'm sorry.
No, that's okay. Just for clarification, there are site visits and there are contract reviews. So the site visits obviously happen during the program time, but the contract reviews and the reviews with the provider agencies used to happen in the evening when families were available. So that's the part that has changed in terms of getting our members to participate in those reviews. And also, we also did quarterly contract reviews, which has come to a halt since the COVID because we're no longer meeting with people physically. We tried to do it online and it just became cumbersome. So, yeah, sorry.
No, I understand.
Yeah, and that's a good distinction that there's the site visits versus the annual contract reviews. So I think that's something obviously we can take back on our end. And, because I think the overall point of all of this is that we realize there's information you need to be able to make informed decisions. So that's what we want to get to and get that to you. So, do we have any other questions before I move on to the other couple of things?
To go.
All right, I don't see anyone raising their hands virtually, so can you move to the next slide, Josie? So, quickly, because I know I don't have too much time left. I realized I've been doing this for roughly 3.5 years, and we've spent a lot of time over that 3.5 years talking about family reimbursement, which isn't a bad thing. You know, we spent time developing an ADM and working out the kinks in that ADM and all of that. But you know, FSS, I know everyone at the table knows this, but maybe not everyone. It's in the forefront of everyone's mind. There's a lot of other FSS programs and services out there that, you know, we haven't highlighted as much on. And this actually ties back to the brochure we mentioned earlier. We've worked on, you know, grouping a lot of those different contract types together. I think we have roughly a dozen different types that you see in front of you. I know someone will say that there's a contract that doesn't fit into one of these categories, but by and large, these categories do cover a lot of what other FSS contract services are out there. And the ROs, along with collecting contract information, also sent us a few program highlights. And I thought it would be good to take, I've got about 10 minutes, so I might be speaking quickly to review a couple that we received from the regions, just to once again point out that there are other things going on besides family reimbursement, and also tying back to the program directories, that these are some of the things when, you know, people look at these directories, these are programs that are out there, you know, helping families in different ways. And like I said, I'm going to run through these a little bit quickly, but do you mind advancing the slide, Josie? So I've just got a few from each region. Region 1, they highlighted a few different things for us in general. Mentioned training programs that they have geared toward parents, some crisis behavioral services that are available through FSS, crisis rec programs that also provide respite services, transition programs that aid graduating students transition into the adult world, and also individualized behavior service programs. We said that's just a real brief, some of the highlights that they provided for us from Region 1. Can you advance the slide, Josie? Region 2 gave us one from each of their districts. Sunmount mentioned the GOAL program that provides integrated classes and workshops with a focus on arts, primary education, and life skills. In Central New York, they specifically mentioned the SIB Shops program, this being a facilitated support group for siblings with a developmental disability. And then in Broome, they mentioned the Parents Networks Lending Library, which provides various educational materials for borrowing on-site and at events that they have. So can you advance the slide, Josie? Region 3, specifically from Taconic, they mentioned their behavior support program and provided a brief testimonial that they got. I'm going to paraphrase a little bit, but they mentioned that this particular family, their son has autism spectrum disorder, is nonverbal, been working with their behavior support staff for quite some time, and it's been life-changing. The person working with the family and her son now has a voice and is able to better express himself. She, being the person providing the service, educated them about the options of an electronic device, instructed them how to use it. And now her son has his own device, which he's using fluently. They don't know what they'd be able to do without that. And close with saying she has been a blessing. So can we advance the slide, Josie? And then a couple more from Region 3, specifically in Capital, the Social Relationships and Sexuality Education Program. It's been featured on the local news, one-to-one support offered for individuals with IDDD navigating relationships. And in Hudson Valley, offerings include indoor and outdoor sports lessons held weekly at SUNY Purchase. And this has been a highly popular program in their words. Participating teens and young adults receive assistance instruction from local student athletes. Next slide, please. Region 4, they provided the successes of the Educational Advocacy Program, which assists families in navigating the complex and overwhelming NYC DOE special ed system. And the a sample of some of the highlights include securing multiple placements for students at non-public schools, helping students who were falling behind in high school classes get the support that they needed, and also assisting a student who had been homeschooled for the past 2 years in transitioning back into a less restrictive community-based school-based school program. So next slide, please. And lastly, in Region 5, they provided information on 2 popular programs. There's a program that offers the opportunity to learn how to ride and care for horses during year-round individualized sessions. The Region 5 shared an individual that was observed at the site visit that took place this year was nonverbal before spending time with the horses. He is now communicating with language along with caring for and riding the horses. And lastly, they also have a 1-week summer day camp for individuals ages 3 to adult. Campers participate in things like horseback riding, sports, arts and crafts, swimming, and special activities. Oh, closing, because I know I don't have much more time. I thought it was important, we thought it was important as a team to mention some of the things, the programs that are out there that FSS does support. Once again, partially tied to the RFP work that's forthcoming and determining needs, but also just because we really did look back and we realized we do spend a lot of time talking about family reimbursement, but we do have quite a bit of resources also tied toward these other FSS contracted programs. I can answer any questions in the, 3 minutes I think I have.
I just have a quick question. The source of this information that you've presented?
This came from FSS regional office staff.
Okay.
Can we get copies of the slides?
Yeah, I had just messaged Kathy on the side. We are going to share a PDF version of the slides with the co-chairs. I saw a lot of people snapping pictures, so yes.
Not me.
I could show mine.
Yeah, I think we need to make that announcement more. So, but yes, we'll get that out to everyone.
I do have a question. In 2021, I think it was supposed to be in the December meeting, but it ran over because it was a big ADM meeting. So I'm not sure if it was because we moved some of the agenda to March, but either way, we received it was done in 2021, 2018 funding by service category across the state. And I was wondering if we could get updated figures. I mean, it's interesting because according to 2018, 32% of the total at that time, 57 million, was for reimbursement. Would that be possible to get the same breakdown, more current than 2018?
I think part of that is what Nick is pulling together is the breakdown by FSS program and contract. So I think we'll have to talk about how to do what was from 2018 again, because that was actually through a survey of the providers. So it was just resourced a little bit differently. So let us just figure out, if that's another thing that is requested to support the local council functioning, let us just reorganize and understand how we might be able to do
You have
that.
a good memory. Right. I did read it was a survey. I
Yes.
forgot already. Okay.
Anything else before we move on to the last part of the meeting?
Dennis, you're good?
Thank you.
Okay.
Thank you, Nick.
Thank you. So, just on time, we're ready for public comment. Just a comment, I'd like you to all, please, when you come to speak, speak loudly, state your name, limit your comments to 3 minutes. Mary Fasano will let you know if you're going over. You saw her get me to stop. What? And where you're from. And just remember, this is a public comment period where it's not an opportunity for a discussion or getting answers. It's just to comment on a matter of the interest of the statewide council. So I thank you, and I guess we'll start. Well, Albany has nobody. And we'll move on to Buffalo. Do you have anyone in Buffalo who'd like to speak? Buffalo?
No, we have no one that needs to speak. Thank you.
Okay. And Manhattan?
I think we do.
Yes, we do. No. Okay, who wants to go first?
Okay,
Sure.
then it's just, good afternoon. This is Christopher D. Greif.
Where are you from?
I'm from Brooklyn, New York. As you know me as an advocate for disability for over 30 years. I like to say this in a very good way. First of all, I want to thank everyone from the staffs around, but I still like to remind that we need to remind some of our staff to continue still working as a team, playing, because if a person is an individual who is trying to work as a team player, and I'm using a sport term, how we're supposed to work together if that person is going to show disrespect. We understand staffs are stressful. We understand during COVID it was strainful. But if we don't work together in our regions or wherever we go in the New York area or outside New York, how we're supposed to work together on this. And, I've been, trying to work very hard and advocating, but if people with disabilities like me as an individual, not a sub-advocacy, so I want to make that clear, I'm my own advocate as a person with a disability, where is the courtesy and respect for that? And I have to say that there are some and there's none. So I hope in the near future, as we're coming into the next year, 2024, I hope to see more things coming up. And Commissioner, I want to thank you for mentioning the disability. I'm just saying for the record, thanks to the commissioners for OPWDD and the staff for celebrating Disability Pride Month. I have a lot of people saying thank you very much. And I do want to say happy belated Disability Pride Month. Thank you. And thank you, Mary, for reminding me that.
Did you want to say anything?
Thank you, Christopher.
Do you want to have a comment?
You have a comment?
No, I don't. My comment would be,
Tell them who you are.
What is your name and where are you from?
my name is Cheryl Scarlett. I'm the parent of a special need individual. And I'm employed at Hudson Valley OPWDD. And one of the earlier mention of hooking the individual parents into services that's one of my biggest concern, is to grab us and let us know what's going on and how to access all services.
Mary, it was hard to hear over here.
Well, what the woman said, she's a parent who was also employed by OP, but her biggest concern is getting involved and how to get hooked into services. So we've tried to help her a little bit here today, but she sees that as an overwhelming need, just to get people in the right door. Maybe not the front door, the right door.
Yeah, because I just want to add on, it's even though you may work in the system, when you're a parent, it becomes an extremely overwhelming and stressful. So we need to remember that parents that work in the field need help and support too.
Ladies, you agree with both.
And I just have a comment from Maria.
Yes.
I just have a quick question. I heard that she was from Hudson Valley. Could you be more specific so we can hook her up with the right local?
Well, Maria, I've already gotten information. I was going to text you later on.
Terrific. Thank you.
Okay. All right. Thank you.
Okay. Okay. And if anyone out there would like to speak, please raise your hand and Josie will call on you.
At the bottom of your screen, there should be a little virtual hand. Okay, if you raised your virtual hand, I'll call your name and then I'm going to send you a request to unmute. Paul, you can unmute. You're unmuted. Do we have anyone else who wants to speak? We normally have a lot more hands. Paul, you can try to speak. You're unmuted. Is there anyone else that wants to raise their hand?
Steve?
Steve, I've sent you a request to unmute.
New York. I'm a parent of an autistic adult child. Back when he was diagnosed, there wasn't any services, so I appreciate OPWDD being around now to put new services in for stuff that I didn't get. But what happened was I wound up being an advocate for many, many others, and I can give you so many stories over the years of parents and even parents nowadays that are falling through the cracks, so to speak, with some of this stuff. All I would ask is that you continue to listen. I'm impressed with the fact that you guys are listening now, much more than if you'd asked me this 3 years ago, 5 years ago, I would have said, gee, we're not getting anywhere. We're treading water. But I do feel that you guys are listening. I do think that you need to continue to listen to the parents. And I really think that you need more representation with the parents on as many of these committees as you can get, because we're the ones that have the stories. And again, thanks for all of this meeting today. I appreciate your time.
Thank you, Steve. Anybody else who would like to speak?
Okay, we have Catherine. Catherine, you're unmuted.
Thanks. I am an FSS provider here in Region 4. I wasn't able to attend the entire meeting today because I'm providing services and there are IEP meetings and other things that are going on, but wanted to thank our FSS providers and families for their partnership. And I hear from parents here who make these councils really represent their communities. And I just wanted to say thank you for being our partners, because our folks at the DDRO, our family support coordinators and the family support advisory councils are always there for us when we ask for their guidance, their feedback, their input, and when they know the work that we do, but also just hearing how important it is and hearing from families today and from OPWDD. We really appreciate the opportunity to do this work with students and families with IDD. And so thank you. Just wanted to say thanks, because it's a lot of work and we really appreciate everyone here.
And Catherine, we appreciate all you do for our families down in New York.
Thank you, Catherine. I see in the chat that Jackie Jacqueline Tripodi would like to speak.
Oh, can anybody hear me? This is Paul Mazzana. Would like to speak?
Paul, we can hear you.
Oh, great. Thank you. Okay, so my name is Paul Mazzata. I have a 43-year-old autistic. Hello. I have a 43-year-old autistic son who is presently in a group home here on Long Island. My wife and I are trying to develop perhaps a situation sort of based on assisted living where people with maybe that don't need very, very high level of support that are currently in a group home could perhaps move into an assisted living type setup that maybe one or two staff members, you could have a ratio of maybe, one staff to 10 to 15 adults can live together in sort of like an assisted living setup. And I'm trying to find out more information as to what boards we can join or if a parents group we can join that, maybe we could present this to OPWDD and it could be a win-win situation for them because the cost of keeping a child in somebody in a group home as opposed to maybe an assisted living setup, the state could be saving quite a bit of money. So I don't know how to go about that, but my wife and I are willing to join any parent groups or boards. I have previously been on some disability boards myself through my business, but I'd like to find out if that's possible.
Well, although this is public comment, as explained earlier, I have one of our statewide members typing in her email, Maria Suchi Kozak, and I would suggest that you reach out to her.
Thank you very much.
Hi.
You're unmuted.
Thank you so much. I'm Jacqueline Tripodi. I work with an organization downstate that provides family support reimbursement. And we do appreciate the conversation that was had earlier about the continued training to care managers and to family members. We are really struggling to try and serve families as we are not getting the appropriate documentation and justifications that OPWDD is asking for us to process the requests. We are trying to work with families. So it is a real struggle for many families and many care managers. So I just wanted to say thank you for listening, and I look forward to seeing these types of trainings to continue, perhaps in more detail, so that this way we can clearly and effectively help these families that we're trying to help. Thank you.
Thank you, Jackie.
Do we have anyone else? I have no other hands currently. We have Sandy. Sandy, you should be getting a request to unmute. Sandy, you're unmuted.
My name is Sandy. I'm a mom of an autistic young man, and I'm very happy that OPWDD is giving courses that will boost the DSPs because the DSPs are so important. They are great. The ones that help Sam in his program, they really got to know him and they get him, and he's doing so great in there. And I just hope you can keep supporting the DSPs because they are wonderful people.
You're not that old, Sandy. I know her. Thank you. It looks like Anybody else coming up?
We currently have no other hands.
Okay. Well, thank you, everyone, for joining us today. for
Excuse
your-
me, Kathy, it's Debbie. There was
Okay.
one more thing I was supposed to bring up, but got interrupted. I'm just bringing this really fast. It's gonna go less than 3 minutes. Can you please see that there's updated training for the conflict of interest forms to do it, how to do it in case any additional changes? Because sometimes some of the instructions are not always well understood, and I am going to use me only as example. I'm not a lawyer. I'm not trained in that, even though I've been trained through my community board, but that's toward a community board for conflict of interest. I just want to make sure, because conflict of interest forms, we have to fill them out correctly. So if legal can keep sending any updated instructions or additional help, that our councils, so the chair and the statewide members can always have the updated forms and know what to do. Thank you.
Thank you. I think we did cover that. And what I had just noted to Chris was if there are any outstanding questions on conflict of interest forms that are not captured in the bylaws and not captured in the instructions, please let us know so we can just understand what additional resources need to be developed. So we just need to really understand what the outstanding questions are and if they are not already addressed in the areas that I just mentioned.
Thank you very much, Alexis. I will not discuss it through a public comment, but I will get back to you after the other Jewish holidays, because then I can talk to the person who has the question.
Thank you.
I see we have Trish.
I have a quick question. I'm in Capitol, and I've been on the council for quite a while. And the question I have is, there's areas in the state that don't have any council members. One that I know of is Taconic, where there's maybe one person. Is there anyone recruiting people for the areas of the state that do not have council members? And if not, can there be?
Absolutely. Trish, are you in the Taconic area?
I am on the Capital Region Support Services Council, so I am connected to the Taconic area because they kind of combined. But no, I'm not. I do not live in the Taconic area. But it concerns me. I don't know how many. I have no knowledge of how many areas in the state don't have any council members. So then, what happens to that?
We are aware of what areas, and Taconic is probably the only one that doesn't have any members at all.
Okay.
The remaining councils have members. Some are struggling getting back to regular routine.
Right.
It's something we're working on as we speak. But if you do know anybody in any area of the state, you have mine and Gail's email in that chat. Send it to us and we'll be happy to.
Okay, so the answer is that you guys are, I mean, I know there's no magic answer and it's hard to get families because in the capital we want to try to recruit a larger number of people too. We're working on that.
So Trish, this is actually, it's public comment, so we're not answering questions at this point, but I will just note that Chris Palega was the person who was reporting out on stakeholder engagement, and that falls into this category. So there is a group of people who are already really dedicated and focused on recruitment of members. So that would be the appropriate group to reach out to.
Okay, great. Thank you for clarification and that there's a group. So that's wonderful. Okay, thank you.
Thank you. Okay, so that's the end of the public comment period. And I just like to thank everybody for being here today, for all the work the committees are doing, for all the work that our OPW staff and leadership are helping us do. And I just like to announce that our next meeting is November 30th at 11 a.m. till 3 p.m. And also like TGIF, have a great weekend.